This is the California State Senate.
Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
Okay, is that working? Great. Good afternoon. Welcome to this joint hearing of the Senate and Assembly Human Services Committees. I'm Scott Wiener. I chair the Senate Human Services Committee. To my right is Assemblymember Blanca Rubio, who chairs the Assembly Human Services Committee. I represent San Francisco. Assemblymember Rubio represents the San Gabriel Valley. We are joined today by Senator Connie Leyva from the Inland Empire, Eloise Reyes, also from the Inland Empire, Assemblymember Reyes, and Assemblymember Miguel Santiago from Los Angeles will be joining us shortly. Before we begin today, I want to just take a moment of silence for the 15 people who have been killed in the wildfires in Napa, Sonoma, Mendocino, Yuba, and other counties. Just a horrible tragedy. There are still hundreds of people unaccounted for. Thousands of homes and buildings have been just wiped off of the face of the planet, and it's just a horrific tragedy. And so if we could just take including one of my our colleague, Senator Bill Dodd from Napa County, who was evacuated from his home. So if we could just take a moment of silence. Thank you. So welcome to this hearing, and I know we're going to have some fantastic testimony today, which we look forward to. And it's fitting that we are holding this hearing today, which is World Homeless Day. So it's a perfect day to really air this critically important issue of how we stand up for our young people, get people off the streets, and help people to succeed in life. I want to thank our host, the Los Angeles Lgbt Community Center, which is generously allowing us to use this theater today. The center has been a leader on many issues, including helping homeless youth in the Los Angeles, West Hollywood area. So thank you to the center for hosting us. More than 130,000 people are homeless in California. It's a huge number, and it's a human tragedy that has grown more and more visible and dire in recent years. As a state, we do a good job at times of recognizing this crisis by focusing resources, for example, on veterans or on families, and really making a difference. But one segment of our homeless population that has not received enough focused resources and attention, and that too often are invisible to the population at large, are our youth. When we talk about youth, I want to be clear what we're talking about today. We're talking about young people, typically ages 14 to 24, who are unaccompanied. There are other homeless children who are with their families. We know that in our K through 12 public schools, there is a just horrific number of K through 12 students who are homeless, living with their parents, whether it's in cars or in shelters. And this is a big, big problem. Today we're focused on homeless youth who are unaccompanied, who are by themselves, who do not have even parents to help care for them and keep them safe. I want to highlight a few statistics that I know many people in this audience are aware of, but I want the public to be aware of. Nearly 1/3 of the nation's unaccompanied homeless youth live in California. many in Los Angeles and San Francisco, but in other parts of the state as well. Unlike the numbers of chronically homeless adults across the country, whose numbers are in decline due to some focused efforts, it's not nearly fast enough, the numbers of homeless youth are increasing every year. 80% of these youth are unsheltered, meaning that they either sleep outside or in warehouses or other places that are not intended as shelter, or are couch surfing with friends or strangers. Homelessness is growing among college students. 1 in 10 CSU students are homeless, and 1 in 5 students in the Los Angeles Community College District is homeless. Those are shocking numbers and completely unacceptable for people who we want to get an education and get on a good track in life. I know in San Francisco State, we know of many students who are living in their cars, for example, because they simply can't afford a place to live. The numbers that we do have in terms of homeless youth are, we believe, an undercount. Our methodology for deciding who is homeless is imprecise, sometimes subjective, and youth in particular tend to stay hidden from view, whether it's for safety reasons or out of a desire to appear quote unquote normal in school or elsewhere. Homelessness among some groups of youth is very disproportionate. We know that 40% of homeless youth identify as Lgbt. In addition, youth of color, youth who are currently or formerly in the foster care system, and youth who have been in the juvenile justice system have higher rates of homelessness than the population at large. Once on the street, youth are particularly vulnerable to abuse and exploitation and to being recruited or subjected to commercial sexual exploitation. Every young person on the street isn't just a tragedy today, but also a potential long-term chronic homeless person who will be even more challenging as time goes by to get off of the streets into services and on track. I just want to say that I've lived in the Castro in San Francisco for 20 years, and we have a significant number of homeless young people in the Castro and surrounding neighborhoods, and it seems like periodically there's a new young person who appears on Castro Street and who's there and is young and vibrant, and then over time you can see the changes and the deterioration, and it is just an absolute tragedy, and it's a moral failing of our country for allowing this to exist. We also need to recognize that a homeless 19-year-old is very different than a homeless 50-year-old, and we need to help both of these age groups off of the street, but homeless youth need age-appropriate services and help rather than simply being dumped in with the general homeless population. We need to make sure we are focusing very specific and tailored efforts for homeless young people. I'm looking forward to the hearing today about programs that are working for our youth, about research that we need to be aware of, and ways we can prevent youth homelessness. And I'll be honest that one of the reasons why I don't want to speak for my colleague, Assemblymember Rubio, one of the reasons that I was eager to do this hearing is because this issue has not gotten enough attention. We want to give it more attention and elevate it in the consciousness of the public and of the legislature. And in my view, we need more resources from the state for youth homelessness. And it's my hope that this could be a first step in building the support to have more help from the budget to get help for these young people. So now I'll turn it over to my colleague, Assemblymember Rubio, the chair of the Assembly Human Services Committee.
Thank you. Thank you, Senator Wiener. It's an honor to join you and our colleagues today. Thank you for making the trek from the San Bernardino area. it is fitting that we're doing this on a World Homeless Day. I want to say that we were brilliant and decided to do it today, but it was actually a coincidence. I think it's a great coincidence because it really does shed light on, we go on about our daily lives and we really don't stop and think about what's really happening out to our youth. As legislators, it is vital for us to understand the needs of California. We just finished an amazing session where we addressed a lot of the beginnings of addressing the housing crisis in California. But Senator Wiener is correct. One of the issues we didn't address is the youth homelessness, which I think should have been part of the discussion. And hopefully we can continue that discussion in the coming months and years as we try to address the housing crisis in California. As a teacher, I taught for 16 years. I can see the effects on homelessness in our youth, the effects in the schools, in the classrooms. He mentioned a couple ways that people are getting by in their cars, but there's also a population that lives on those vouchers for hotels. And I taught in Fontana, and I didn't realize how many of those students lived in hotels, and I had issues on Monday morning where they hadn't had a hot meal the whole weekend because they were living in a hotel. And this was shocking to me. I understand that those communities are poor, but to the point where our kids don't have a hot meal, a whole entire weekend, and that was very devastating to me. I've taught for 16 years, and I feel like I'm very strong, but that day when I found out that 2 of my students hadn't had a hot meal, it really made me reflect on how desensitized we really are. Even me as a school teacher, I see it every day, but I was shocked to find out that these kids hadn't had a hot meal. The statistics that Senator Wiener just described to you about our college students that are homeless, they also, and by default, if they're homeless, they don't have food. They get by on the kindness of others, or sometimes they just get by without any food. So along with the not having any homes, they don't have food. And so some of our college students are trying to do their best without homes, but they're going on about their learning day without any meals. And so that is very touching on so many levels, but it is distressful to know that we live in one of the richest countries in the world and the richest states in the world, and we have a huge population of youth that are being neglected. And so my hope today as well is to hear from the panelists and begin the discussion on how we can help in the legislature. We did a fabulous job, I think, beginning the conversation on the housing crisis, and I think that perhaps the following year and the years to come, we can address the issue of homeless youth as well. So I'm looking forward to the discussion from the panelists. Again, thanks to my colleagues for the opportunity to address you today, and hopefully the discussion that we have can result in some solutions. I do get frustrated. It is my first year in the assembly, but I get frustrated at all of the discussions we have, and they really don't go anywhere. I want to have a discussion that results in some action. Even if it's a small step in addressing this issue, I'm tired of the discussions. Let's have discussions and try to implement some actions to this. So thank you again for the opportunity to be here. And I'll go ahead and we'll be alternating with the panelists. So I'll turn it over to Senator Wiener. Thank you.
Thank you. And I also want to give an opportunity for Senator Leyva and for Assemblymember Reyes to make any opening comments that they would like to make.
Thank you, Senator Wiener. Thank you, Assemblywoman Rubio, for having me here today. Really, homelessness and homeless youth is the crisis of our lifetime. And if we can't come together and figure this out, then it's hard to justify that we're the 6th largest economy in the world here in California, but yet we also have the highest homeless population. I think this year we did a really good job. SB 2, Senator Atkins' bill, will create regional centers for homeless to go to. And we think about on our own lives when you're trying to figure something out and you have to go here and you go there and you have to talk to all these different people. I can't imagine trying to do that and find services if I am homeless. So the fact that we'll be able to create these centers, so if you are homeless, you can go there and get all the resources that you need and that are available to you. But I will also just say that for me, the reason I ran for the Senate is because I think a good job fixes a lot of what ails us. And until we focus on good jobs and affordable housing, I think this is going to be a long haul for us. But I'm thrilled to be here. I can't wait to hear from our panelists. I appreciate all of you being here and being interested. This should be our collective issue moving forward. Thank you for having me.
I too, like Assemblymember Rubio, am new on the job. We've been on the job for 8 months. I've got to tell you that it has been a wonderful experience. One of the things that I did when we started is that I formed advisory committees in the 47th Assembly District, which is entirely within San Bernardino County. And many of my youth especially said, can you form a separate advisory committee for homelessness? Because housing is one area that, yes, we want to talk about housing, but can you do one for homelessness? And my LGBT community, my students especially said, and can we specifically talk about how it affects us? Because it's something that is very specific that we have to be aware of. We can't just say, okay, it's housing, okay, it's just homelessness. There are so many issues, and it isn't until we hear from experts who can tell us, or very, very specifically to hear from the people who are affected by this. That's how we learn. Many of the bill ideas for me in this first term came from the community, and I expect that my next term will include many bill ideas that will come from my community again, and I'm looking forward to hearing from the panelists because I know that we will get some ideas as well. I really appreciate our chairs, Senator Wiener and Assemblymember Rubio, putting this hearing together, and as you can see, San Bernardino is well represented. The three of us represent many in the San Bernardino area, in the Senate and the Assembly. It's something that it troubles us. But just as Assemblymember Rubio said, we need to go beyond just talking about it. We really need to act. And I think that with our collective help of all of you here, I think we should be able to come up with a legislative package that will move us at least a few steps forward. And I'm looking forward to that. Thank you.
Great, thank you, colleagues. And before we get to the first panel, I also want to thank the staff of both the Senate and the Assembly Human Services Committee for doing a great job organizing this hearing, and also the staff of our Senate President Pro Tem, Kevin De Leon, and the Speaker of the Assembly, Anthony Rendon, both representing Los Angeles County, for supporting our efforts and working with our committees. So thank you to everyone. So with that, we'll move to our first panel. We have 3 panels today. The first is entitled A Growing Concern, California's Homeless Youth. The second is identifying and addressing the needs of youth who have experienced homelessness. And the third and final panel will be emerging solutions. And then after the 3 panels, we'll open it up for public comment. So the first panel, if the panelists could come up, this is A Growing Concern, California's Homeless Youth. The panelists are Simon Costello, Director of Children, Youth, and Family Services at the LA LGBT Center. Alex Ix, a young person who lived through a homeless experience. Sonali Patel, who's a policy fellow at Chapin Hall at the University of Chicago. Cynthia Nagendra, who's the director of the Center for Capacity Building, National Alliance to End Homelessness, and Ben Johnson, who is Fiscal and Policy Analyst at the California Legislative Analyst's Office. So I'll turn it over to the panel, who will make their remarks and presentations. If you could identify yourself.
Yeah. Good afternoon, everybody. I'm Simon Costello, Director of Children, Youth, and Family Services here at the Los Angeles LGBT Center. First of all, thank you, Senator Wiener and Assemblyperson Rubio, for holding this hearing on youth homelessness. I'm pleased to welcome everybody here, and I'm really happy to have this opportunity to speak to you. I would like to start the conversation today by talking about the youth we see in Los Angeles County and here at the Center who are experiencing homelessness. And I hope I can shed some insight as to who these young people are, what has led them to be experiencing homelessness, and what are some of the services and support they need to help them achieve housing stability and achieve their full potential. First, I would like to provide some numbers and demographics. In January this year, the Los Angeles Homeless Services Authority led community members and volunteers in a homeless youth count. And they found that on any one night, there were just shy of 6,000 young people here in Los Angeles County who were sheltered or staying in emergency shelters. And since we know that young people tend to cycle in and out of homelessness, that leads us to believe that over a 12-month period, there's obviously many more than that number who are experiencing homelessness here in our county. This count also collected some telling demographics. Over 90% of the 6,000 youth were between 18 and 24. 80% were young people of color. 70% were from LA County, and that was a surprise. 70% were LA County, and less than 20% were from out of state or out of the country. So these were young Californians. Several years ago, the Hollywood Homeless Youth Partnership, which is called the HIP, did an extensive survey of homeless youth here in Hollywood. And some of their findings struck me as particularly informative. 40% of these young people reported of having been removed from their home by Child Protective Services. Less than 50% of the young people between 18 and 24 had a high school diploma or a GED. Less than 50%. And 49% of these young people met the criteria for clinical depression, and 18% met the criteria for post-traumatic stress disorder. There are many other factors that compound a young person's experience, including socioeconomic status, abuse and neglect at the home. Any of these factors, or a combination of them, can result in a young person finding themselves without their own home and without the support of a family unit or caring adults. Last year here at the Center, we provided services to over 1,200 young people who are experiencing homelessness. 880 of them were first-time clients. That means that every week between 15 and 20 new young people experiencing hopelessness walk through these doors at just one agency. So if you can imagine that, that is a crisis, or this is a crisis, and this is totally unacceptable. I'd like to talk a little about two of the factors that we see at the Center that lead to young people experiencing homelessness. The first one is many of the youth we see tell us that the reason they left home is due to family rejection of their sexual orientation or gender identity. And this is reflective of national statistics which tell us that between 20 and 40% of homeless youth identify as LGBTQ. But what does that mean? What it means is that many of these young people have been forced to leave their home when they came out of their parents, or their parents or their family found out that they're LGBTQ. Others found themselves living in a family or a community that was unsupportive or even hostile, and had to leave home in search of a more safe and supportive community. Another driver of youth homelessness that we see at the Center is young people who have cycled in and out of foster care and find themselves aging out of child welfare without the support of a family unit or caring adults. Many of these young people have bounced around between different schools while in foster care. And then they find themselves on their own as young adults with limited education and a lack of employment skills and life skills. A number of years ago, we commissioned the Williams Institute at UCLA to do a survey of LA County foster youth. The survey found that just over 19%, or nearly 1 in 5, of youth in foster care between 12 and 18 identified as LGBTQ, and 90% of these were youth of color. These youth reported a higher number of foster placements and were more likely to be placed in a group home. Also, 21% of them had already experienced homelessness, compared to 13% of the non-LGBTQ peers. Now, many young people branch out on their own at 18 and head off to college or to start a career or start a new job. It's a normal part of youth development for young people to try new things. But also they sometimes fail. And most young people are fortunate that when they have these situations, they have a family to fall back on, and small failures result in small setbacks, nothing more. For a young person who has to survive on their own, small failures can have catastrophic consequences. For example, losing a job can result in losing housing and starting a cycle of homelessness. So what are the options for a young person who may find themselves without housing? We do have emergency, transitional and supportive housing for homeless youth here in LA County. However, the number of beds is limited and there are always wait lists. Thanks to Measure H, we will be increasing the number of beds over the next few years, but even that is unlikely to meet the need. Many young people who are homeless, even in our program, cannot find a bed in a youth emergency shelter or do not feel safe in an adult shelter, particularly if they identify as LGBTQ. They end up living on the streets. And there are many risk factors to living on the streets. Senator Wiener mentioned some of them there: various forms of exploitation, unhealthy coping mechanisms, including substance use, and involvement with law enforcement. And what I think is the greatest risk for these young people who are living on the streets is the risk of normalizing their circumstances. These are young people who are in their formative years. What damage has been done to a young person who finds themselves surviving on the street and shut away from community? This is when they begin to lose their sense of a positive future self for themselves. And this is where we begin to see the biggest challenges as service providers. So, what does success look like and what can be done? For a young person who's experiencing homelessness, success is ensuring that the event is brief and non-recurring. It is helping each young person achieve their full potential. Obviously, the first thing we think of as service providers is providing a young person with a safe place to stay. That's only a small part of what they need. We need to take an holistic approach that encompasses their health, their mental health, education, employment, and life skills needs, among other things. We need to meet each young person where they are, engage them in a conversation about what they want from their lives, and provide them the resources and the opportunity to reach for their goals. And for the community and for us, what does success require us to do? I would suggest it requires us to do two things. Number one, we need to implement a statewide framework and a structure to prevent and end youth homelessness, and the members have already touched on that today. And we also need to look at the factors that contribute to the cycle of youth homelessness, unpack each of these and diligently work to stem the pipeline of youth into homelessness. Thank you.
Thank you. If I could just also ask those, and this goes for all panelists, those were amazing, sad, tragic statistics, but afterwards, if you're comfortable just providing that to us,
Sure.
I'm going to try to compile all the information, and that would be great. Thank
you. Hello, my name is Alexis. I'm one of the many homeless youth in LA County. I'm currently in a sheltering program at the LGBT Youth Center here in Hollywood. I'd like to speak a bit of my life during my teen years to where I am now, currently. At 18, I became part of the foster care system at Merced County here in California because of some family issues that I don't really like to speak about. Through the years that I was placed in foster care, I had to deal with being bullied because I wasn't manly enough for things. I was seen as extra weight for many of the foster parents, and I kept getting transferred all over California because no home would take me in. I kept getting moved further and further away from my siblings. During my time in foster care, I was placed in 26 different placements. At 16, I came out as a homosexual youth, and being gay, my life became much tougher because my social workers could not find anywhere that wanted to be LGBT friendly. Any foster homes just didn't care for any of them. And I started getting placed in different group homes. It's like, it was so much tougher for me because of that. I kept getting targeted for things, like I always kept getting bullied, kept getting basically thrown under the bus for stuff I know I did not do. It was coming close to me being 18. I was about to be emancipated from foster care, and it seemed like the system never truly even cared about me. They just basically tossed me to the side. Like, they didn't help with no transitional housing. They didn't help with, like, me finding work. They didn't really care to understand what was going on and what I could get help with. I looked into basically transitional living programs, and I found one. But as soon as they found out that I was basically gay, they didn't care and just kind of just acted like I never looked for anything, and my file just always deleted from anything. Before I actually emancipated from the system, I tried to find counseling because I wanted someone to try and hear me out and maybe help me out before I became a young adult. There was no one there that really tried to understand my pain and frustration and what I was going through, so it wasn't really something they cared about, and that really got me nowhere. When I did hit 18 and I emancipated, I basically had to find my own work. I had to basically finish high school at 18 still, and I was able to get my diploma, which was very helpful for me. I actually got to understand that basically being 18 and with basically fostering not being able to do anything for me, I was able to see that I had to work my hardest to get my own kind of money, my own needs, and that's basically where I got through most of my life, was doing stuff like that. Through the years, I basically started dealing with just having to basically work on my own, live out of my friend's car, go to college while I was still basically very unstable, and still try and work like a little small job on the side as well. When I hit 21, I tried to get near my family, but none of them actually even cared for me. Actually, yeah, even after I hit 18, none of my family cared for me at all. Like, I was basically seen as nothing. They thought I was a sinner. They thought it was just a phase that I was going through. Like, they never really tried to understand anything at all. And when they said that they were understanding, it was basically an epic lie, because I know they were just putting up a ruse. When I hit 22, on my 22nd birthday, I actually came out as transgender, and it was like the worst time of my life, because I just kept hearing my family tell me, you know, you're not a woman, you don't understand the gender, you're not gonna make it anywhere being that type of way. So it's like, it felt like there's no one there for you no more. I tried to get into counseling, and that's all they wanted to do was put me on medication, saying that maybe meds will help me. But that really wasn't gonna do anything for me, because I knew who I was, I knew where I was going with my life. Later in the years, I basically realized that being transgender, I didn't really get much choices anywhere, so I chose to basically run away from my problems and try and go somewhere where I didn't think anybody would even understand me or try and care. So I did come to Los Angeles. 6 months ago, I started learning how it was to become homeless, because when I did come to LA, I was offered a position at a clothing department. And then I was offered to live with a friend of mine, and both didn't go so well. When I went to the clothing department store for the interview for my position that they offered, as being transgender, I was basically kicked out the door and told me that the position is not mine no more. And then when I got back to my friend's house, I found out that they basically took off and all my stuff was stolen. My money was stolen that I had left with them, and they were nowhere to be found. The first night here in Los Angeles, I basically stayed in an alleyway somewhere downtown, and it was frightening. It was like the worst thing ever, because I didn't know who to talk to. I didn't know anyone here. I basically held my stuff very closely to me, and it was just scary. It basically felt like just a dark hole that I basically just have jumped into. I was basically jumped for all my stuff. I was basically attacked, and all my things that I had with me were gone, and I didn't know what to do. I didn't know what to say but cry and basically feel like my life was like done for. I became depressed. I became just like I wanted to just hurt myself, like isolate myself, not care about anything, not wanting to get anywhere. Then the next day, I got into a shelter, and the shelter was not great. Shelters here are very, this is a huge struggle for being transgender, for being anything from the LGBT community. It's like being a youth as well. Just, you don't get what you hope for in the shelter because you're just basically seen as nothing or seen as extra space that could be used by someone else. I then heard through some people, some other youth, about some of the LGBT centers. The one being here in Hollywood is the one I chose to come to after some time of thought. And I realized that when I got there, I basically was seen with open arms. I was accepted. I felt safe. I felt appreciated. I realized there was support for me somewhere. And it was a very different change in life for me because I see that there, as a youth, there are other places that can help as well, being LGBT or not. There's so many places that could help, but you just have to know which one is where and which one accepts you and which one knows what you need, because they have resources that you can use, but it's only for certain people, only for yourself throwing yourself in there and basically pushing to do it, because many times they don't really tell you anything until you find it yourself in the center. So it's like you're there and you realize, okay, food and clothes, but there's so many more things that could be there that you have to find, because many times you're never told what the hell they are. So it's like you feel safe in the area, but it's never really something that gets you anywhere until you have to basically kick them in the side and say, I want to get this done. I want to get my life ready. There's so many other centers I've gone to, but I don't feel appreciated there. There's so many that are very transphobic, so many that are very homophobic, so many that don't want to care to look at you, don't want to care to see, don't want to care to listen to you. And that's not something that you or many others want, myself included, because I'm a working person. I'm a person that wants to get somewhere. But if others are willing to not help you with that, why waste my time to get there? And they just kind of push you out the door because they say that there's nothing here for you. Other centers should allow that. All the centers should be like that. It's just being a youth. It's just, I'm already dealing with having to be homeless. I'm already dealing with having to be stepped on by people that don't want to look at you because they have higher, placement than you. So being in the center, you don't want that. You want to get somewhere. You want to put your foot down and tell them that I want to be back to where I was before, but in the same time, I want to get help. It just, help is something that would be great, because it's just, I can't do much of it, but it would be great if you met me 50-50 in the way, because at the end of the day, it's, it's my life, but they're your resources to help me understand them. And that's much of what I have noticed, that I'm living in a great center. It's somewhere where I appreciate, but there has to be more to it than I know there is. Thank you very much.
Thank you. Thank you, Alexis.
First, I just have to say, Alexis, thank you for being willing to share your story. Good afternoon, Chair Wiener, Chair Rubio, Senator Leyva, Assemblymember Reyes. Thank you very much for the opportunity to testify today. My name is Sonali Patel. I'm a policy fellow at Chapin Hall at the University of Chicago. I'm here to testify on behalf of Voices of Youth Count, which is an unprecedented effort to fill the knowledge gap we've had at the national level for far too long. Through an innovative public-private partnership, we've been able to undertake the most comprehensive policy research initiative to date on youth homelessness over the last 2 years. Let me first start off with some of the overarching lessons that were reinforced during this multi-year initiative. It really does take a village to end youth homelessness. We learned definitively that youth are not the sole actors in their stories. There are many key players, including families, peers, service providers, policymakers, and structural systems that can and do offer both critical supports and risks as homeless young people navigate their housing instability. That was clear as our team listened respectfully to 215 young people's life experiences of homelessness and being unstably housed, and as we partnered with 22 counties across the country, including 3 here in California. Given the overarching lessons that I just touched upon, I want to now turn to sharing some of the thinking and the underpinning of the work that we did over the last 2 years. As you well know, we appreciate the outreach data that HUD publishes in their annual homeless assessment report, the AHAR, of which the latest data indicate that there were nearly 46,000 unaccompanied homeless youth, including young parents who are under 25, counted across the country in the point-in-time count in January of 2016. So this is the data that Simon cited and that communities all across the country report to HUD. And those point-in-time counts are important. They give communities an understanding of who's accessing their services at the local level and who's on the streets on a given night. However, it is not a good methodology for determining overall prevalence, which is the measure of how common a problem is. And that's what we've really been lacking at the national level. Our impetus for launching Voices of Youth Count has been to provide a national prevalence estimate, which we haven't had before here in the United States, but also not just to get a number, it's to better understand the challenges and the opportunities that these young people face on a day-to-day basis. So this is a multi-component initiative. We did conduct a national survey to get to a representative sample of this population, which has not been done before. And we know it's a fluid and hidden population, and I think I want to underscore the fluidity of that. As we did those interviews, it was clear that young people aren't always just out on the street. They are sometimes couch surfing. They are sometimes in other unstably housed situations. It's not a straightforward story that they live. Our initiative was designed primarily to produce national level evidence and federal policy insights, as well as local lessons specific to those 22 partner counties that we worked with. But for the purposes of this hearing, our team did assemble some of the state-specific emerging findings that we're seeing from the data collected across those 3 California counties, which were Alameda, Mariposa, and San Diego. The data I'll be sharing today is primarily from 2 different sources. It's from those in-depth interviews and then from brief surveys that we did on the ground last summer in those 3 counties. The data, I have to underscore, my research team wants to make sure I underscore this. They are not representative of the population as a whole in California or nationally. We will be coming out with those numbers. It'll just have to be in mid-November. But we will give a view, but these data will give a view into the characteristics and experiences in the lives of these very vulnerable young people. As I mentioned, in mid-November, we're going to be releasing our national survey results with an estimate of how many young people and young adults ages 13 to 25 that experienced homelessness over a 12-month period. So this gets us beyond that one-day count. And given the timeline, I'm going to share what I can today on our emerging findings, but I'll also offer to reach back out to you after our national release and share more specific data that we just aren't able to share today. So to give an idea of some of our findings, we know that there are certain subpopulations of youth that were overrepresented amongst those experiencing homelessness. Across the 3 California counties, we found of the youth who were homeless, approximately 2 out of 5 identified as Black or multiracial, 1 out of 4 identified as Hispanic, 1 out of 5 identified as LGBTQ youth across the 3 counties. About 1 out of 5 identified as pregnant and parenting. 2 out of 5 were in a shelter, while 1 out of 3 indicated they were unsheltered. And 1 out of 3 reported having some level of employment at the time of the interview. We can say that the national survey that we'll be releasing in mid-November shows that housing instability and homelessness for young people is a bigger problem than we've previously been able to document in a reliable and easily replicable way. And I wish I could share that with you today, but I promise we'll come back and share it. We also found that about half of those young people reporting homelessness in the last 12 months reported having experienced it for the first time in their lives. This indicates that moving upstream in policy solutions would have a real impact. Our qualitative research, those 215 young people that we were able to do those in-depth interviews with, shed some light on early warning signs and intervention opportunities to address this challenge in the very early stages or even before it begins. Our interviews with young people experiencing homelessness indicated that about half first experienced homelessness or housing instability as children, so in many instances with their families. Almost half of the young people we interviewed experienced some form of stigma or discrimination within their families while they were stably housed. About 1 out of 3 youth interviewed endured the loss of a caregiver. About 2 out of 5 interviewees had had foster care experience, and certainly as Simon referenced, this suggests that our child welfare systems can be strengthened to prevent runaways from foster care or entry into youth homelessness as they age out, or supporting families where a young person might get reunified, but they might struggle and still end up on the street. So there are multiple points at which intervention is possible. And 1 out of 2 interviewees had had a juvenile justice experience. These overrepresentations shown across these 2 different ways that we collected information necessitate tailored prevention strategies to address the inequities of homelessness, but also tailored service delivery strategies to ensure the unique needs are met. We know how to solve complicated problems. Together, we have made dramatic progress in this country in other areas of homelessness. After partnering with 22 counties across the country, Voices of Youth Count has every reason to believe we can figure out, as a village, how to ensure our young people don't fall into homelessness to begin with or continue to face homelessness. Thank you for this opportunity to share what we're learning.
Thank you.
Thank you to the Senate and Assembly Committees on Human Services for inviting me to speak today. My name is Cynthia Nagendra, and I am a director at the National Alliance to End Homelessness. And on behalf of the Alliance, I'm very honored to be here with you today to discuss the national landscape on youth homelessness and how California in particular can make true progress on the issue of youth homelessness. And I'm particularly happy to be here as I'm also a Californian. I live in San Francisco in the Castro, so it sounds like we're neighbors. And so at the Alliance, we know that a great deal of hard work and strategic thinking has been going on here in many localities across the state about what to do about youth homelessness. And we wanted to commend and thank these communities in California for really leading the country in many areas of work. For example, Los Angeles, in partnership with Away Home America and the Rapid Results Initiative, was one of 3 inaugural communities to implement 100-day challenges to end youth homelessness. As I'm sure you might hear today, they greatly exceeded their 100-day goal and have begun to really implement real systemic change based on the lessons they have learned. Additionally, 2 Bay Area communities, San Francisco and Santa Cruz, were among 10 chosen from around the country to participate in a highly competitive youth homeless demonstration program funded by the Department of Housing and Urban Development, or HUD. And these HUD demonstration communities will be using evidence-based interventions, as well as try innovating and implement coordinated systemic responses to youth homelessness that will become models, hopefully, for the entire country about the seemingly intractable social problem that can indeed be solved. California has more homeless young people than any other state, and it is a largely populous state. But as you've heard, the numbers are very high here, and a very high percentage of people here are unsheltered. And we know from the progress that's been in California and around the country on other populations experiencing homelessness that it can actually be ended quickly and effectively for young people in this situation. And that the same general approach that we see working in communities for other populations, by and large, a systemic one in which communities come together to coordinate resources and hold themselves accountable for performance goals and outcomes as a community rather than as individual programs, also works to end youth homelessness. So the state of California has a really key role to play in implementing that systemic approach and ensuring that youth and young adult Californians are able to quickly access both permanent housing and the supportive services that they need to remain stably housed. And today I'm going to briefly talk about the national scope of youth homelessness and California's representation of youth, the overview of federal attention, so some federal trends in funding and priorities to and funding specifically for homeless youth, and along with HUD priorities, most importantly, the state's critical role in the solution to youth homelessness. So what does youth homelessness look like in California and in the nation? We've heard a little bit about both here, so I will just talk a little bit more about that. Youth homelessness is tragically an all too common phenomenon in the nation, as it is here in California. While we are all eagerly awaiting the Voice of Youth count data, as Sonali said, we do know that on a single night in 2016, at least 46,000 unaccompanied youth, as she said, and young adults were experiencing homelessness in California, across the country, excuse me. And in California, that number was approximately 12,000. I say at least here because, as we heard, we know that communities have not necessarily had very effective methods for counting youth, and this is just a point in time, and that many young people experiencing homelessness or housing instability remain hidden. Additionally, point-in-time counts are not intended to capture everyone who is eligible for homelessness assistance, and other counts that attempt also imperfectly to capture those numbers include annualized public school data, which found more than 95,000 unaccompanied youth experiencing homelessness or housing instability. But something that is really important to know from all of this somewhat imperfect data is that over 1/3 of that number nationally and around 75% of those young people in California are unsheltered. Indeed, minimally on any single night in California, over 8,000 youth and young adults are sleeping on the streets, under bridges, in tents, in cars, in abandoned buildings, and other places not meant for human habitation. And a significant portion are LGBT youth, as we heard. And this is a crisis which the state can and must address. So we thank you for your prioritizing this today. Due to the federal goal of ending homelessness among families and youth by 2020, which is in the federal strategic plan, we have seen significant increases in federal funding to end and address youth homelessness in recent years. So the issue with that is the funding is still not near enough to address the need, and the Alliance continues to advocate, as a member of Away Home America, to greatly increase that funding at the federal levels. There are a couple of federal agencies that provide the lion's share of federal funding, especially directed to youth experiencing homelessness, and the main ones are the McKinney-Vento Act Homeless Assistance Grants, programs of the Department of Housing and Urban Development, and the Runaway and Homeless Youth Act, or RHYA, programs at Family and Youth Services Bureau with HHS. Within McKinney-Vento, there's also a smaller Education of Homeless Children and Youth program and administered by the Department of Education. The RHY program funding is in about $119 million, the education of homeless children and youth at about $77 million, and in 2016, the HUD homeless assistance grants for unaccompanied youth is around $134 million, and I can give you these numbers, which has been steadily growing. In California, the funding dedicated to homelessness has been growing, but the youth focus on homelessness has not been as robust or anywhere near to scale, as you know. However, it is also important when thinking about funding to address youth homelessness in California that we also calculate what California has implemented, such as robust extended foster care response. Federal funding from the Children's Bureau at HHS, which is the agency that administers child welfare funding to the states. So the state of California spends approximately $2 billion annually on child welfare in county, state, and federal investment. The state investment in homeless youth is about $10 million. As HUD has demonstrated in its threshold requirement, so one of the threshold requirements to get that demonstration money that San Francisco and Santa Cruz have received, the community had to show a true collaboration with this child welfare system in local communities to receive the demo funding. And that's because HUD sort of understands that we absolutely cannot end youth homelessness without having the child welfare system as equal partners at the table. And the role of the states in making that happen cannot be understated. Again, California is leading the way on implementing effective extended foster care, so we expect that the collaboration between child welfare and homelessness systems that California establishes will be models for other states. So I'll now talk a little bit about trends in federal funding and specifically HUD's priorities. So all the federal agencies that make up the U.S. Interagency Council on Homelessness, or USICH, including HUD, committed to end youth homelessness by 2020, as I said before. To that end, we have seen significant increased attention to youth experiencing homelessness across the agencies. But unfortunately, there's only been a couple of small bumps in RHYA, Runaway Homeless Youth Act funding, and it has really remained relatively flat over the years and has never been funded at anywhere near its full authorized level of $165 million. Indeed, only a quarter of programs that apply for RHY funding ever receive it. The EHCY programs have recently received increased funding and help fund dedicated liaisons in public school systems for children and youth experiencing homelessness for housing instability. These funds are, however, not exclusive to youth, and the majority of them serve children in unstably housed families. So it is estimated that only about $4 million of that funding really serves unaccompanied homeless youth. The greatest increase in federal funding for youth homelessness has actually come through HUD, through the McKinney-Vento HUD Homeless Assistance Programs, and that includes a 15% increase for youth-specific programming since 2014, especially in permanent housing resources for young people. And so in 2015 alone, the funding included over $11 million in new programs for youth, dedicated to youth. And it's gone from, in 2014, funding for youth, unaccompanied youth was about $116 million, and now it's about $134 million. And more importantly, in addition to that funding, in the past 2 years, Congress has dedicated $70 million to the HUD youth demo programs. So on top of that funding, there's the $70 million. We expect that to come to, maybe not at that same level, but we expect some of that funding to keep going. This approach is referred to by various national agencies or advocacy organizations like the Alliance as a coordinated community or systemic response, because the systemic response has been so crucial in the communities that we've seen end other types of homelessness. So 51 communities across the country have ended veteran homelessness, and that includes 3 entire states. And this really proves that a systemic approach to homelessness yields the most significant impact in actually reducing the number of people that are homeless. And those communities have, and others have learned that a systemic, coordinated response must involve not only service providers, but city, county, and state agencies, mainstream partners, public and private funders, using a data-driven approach and evidence-based interventions to reduce homelessness for other populations. And so we absolutely must use a similar systemic response rooted in housing first and led by the voices of young people to end youth homelessness. And one thing I do want to say about veterans homelessness too, one thing that we really learned from doing this work across the country is that while there was enough money to end veteran homelessness in every community across the country, the ones that did it, the key difference there was that they had a really coordinated systemic response. They had all of the sort of partners that I mentioned at the table, or really changing policy, setting policy. The communities that just had the money straight to the providers, it just wasn't as easy to really change the system and make a sustainable system. You can get that money out the door in services, but you're not really creating a sustainable system that's going to continue to help get people off the street, prevent them from getting on the street, and housing them quickly. So I think you are probably very familiar with Housing First. We'll talk about it for a little bit, but I do want to end this point by discussing specifically what we think HUD's priorities are. While the field began to understand that homelessness was a crisis a few years ago, to continually have a program-by-program emergency-type response was really just putting a Band-Aid on the problem. And the sort of more complex and comprehensive community-wide response was really needed to build a scalable solution. So you're moving from managing homelessness to really solving it and creating a long-term solution that's going to keep solving it. And so with the development of an organized federal response to homelessness that took systemic and outcomes-focused approach to actually decreasing and preventing homelessness, the national plan called Opening Doors did this by beginning with veteran homelessness because there was a lot of sort of support for it at the time. So this is why HUD is prioritizing these strategies now and trying to encourage COCs and their communities to leverage federal dollars to bring these strategies to scale, ending homelessness for everyone with that systemic housing first-based approach. And this has been really informed by the voices of providers as well as young people at the federal level who are experiencing homelessness or those who have successfully exited it. And given the growing work that HUD is doing, we can sort of see that they do care and they are prioritizing this as an issue. But the approach that's codified by the McKinney-Vento Act and by the Hearth Act for HUD is a fundamentally different kind of approach than most of us have been used to seeing to address youth homelessness. And that approach is, as I said, rooted in the Housing First philosophy, which I will briefly describe. People experiencing homelessness, including young people, certainly have issues in their lives, as we all do, that are particularly exacerbated by poverty. But homelessness is first and foremost a housing crisis, and housing is the solution. The Housing First approach focuses on quickly connecting people experiencing a housing crisis to permanent housing without preconditions and barriers to entry, things like sobriety, treatment, service participation requirements, sexual orientation, while also providing necessary supports to help maintain housing and prevent a return to homelessness. Many programs can be housing first. It doesn't just have to be supportive housing. Shelters can be housing first. They can lower barriers, not have preconditions to make sure that people can get in, get the services they need, and get out to housing. Same thing with transitional housing, rapid rehousing. So these can all be housing first interventions, and the whole system should really be oriented to getting people in as quickly as possible with the fewest barriers and getting them out as quickly as possible into housing. So programs across the country have firmly established that Housing First works for young people as well. One of the common misunderstandings about Housing First is that it's housing only, especially in the case of rapid rehousing, but this simply isn't true. The services are there, and they need to be matched well with people based on their individual needs, and the same is true for young people. So what we do know about youth that might look different in terms of services is that they might need a longer length of assistance on average than for older folks. And the general consensus among rapid rehousing providers is about 9 to 12 months. Specialized landlord engagement techniques to help overcome any youth-specific objections landlords might have, and more intensive services if the youth chooses to have more intensive services, but they should be flexible, especially in the beginning. And as mentioned, Housing First services should be all client-driven and really tailored to each person. So finally, I want to emphasize that to make progress, the state needs to play an active role in promoting the systemic approach to youth homelessness that I've been describing and in allocating resources effectively. There needs to be coordination between state and local entities because the system can't end youth homelessness alone. One major point I want to underscore is that while veteran homelessness was ended in 50 communities, again, the biggest lesson there was that we had state agencies at the table. And all of that needs to be brought together and approached strategically at the state level, where the state needs to be creating policy that mirrors the federal approach. We want the state to mirror the federal approach so they can not only sort of align itself with federal priorities, but leverage federal dollars as best they can. So aligning their approach with the state is kind of the best way to do that. And so to make a significant impact, both to prevent youth homelessness from growing and to actually reduce the number of young people who are experiencing homelessness, a state agency that knows housing really needs to be at the table. HUD is changing and has become invested in using housing-based interventions, so having a housing agency at the table leading this is key. Other states that have shown this type of collaboration works where a state housing agency is involved, the state of Connecticut, Virginia, Washington, Minnesota. Having that housing state agency that really knows how to house people can really help lead a housing first implementation. So I'm just going to close with saying we know these things work because we see it happening in communities like LA that are knocking their goals out of the park with the 100-day challenges. We know there's a lot of work left to do. We see it happening in rapid rehousing across the country. And in this state, it doesn't make sense to let thousands of young people be homeless. I know you know this. And we can end youth homelessness. We know what to do. We just have to do it. So thank you to these committees, and we really appreciate being here today.
Good afternoon. My name is Ben Johnson with the Legislative Analyst Office. I believe the members should have a handout in their packets that will really form the basis of my remarks, which will be on the state's efforts to address youth homelessness. As I think Alexis made really clear in her story, there are still challenges in accessing and navigating these programs, but there are currently existing a variety of state housing programs that assist either directly or indirectly youth ages 16 to 24. Now, for the purpose of this talk, I was going to classify them into sort of three buckets. The first are those that provide housing and housing-related services directly towards youth. The second are state affordable housing and homelessness programs that are available to the broader population, but also will serve youth. And then finally, I'll just remark briefly on a couple of health and human services programs that, while not directly related to homelessness and housing, indirectly help youth avoid homelessness. To start off, though, we would mention that there are multiple state departments that are involved. There's no single state agency that currently that is overseeing or coordinating the state's homelessness activities. There's housing and community development on the sort of affordable housing side. There's Department of Social Services, which runs child welfare and other cash assistance programs. And there's also the Office of Emergency Services, which does disaster prevention and also has a program in this area. There are also multiple federal, state, and local funding sources that are involved. And oftentimes, these funding sources actually go directly to localities rather than necessarily running through the state budget. And the localities actually have a lot of discretion about how these programs are run. So while I'm surveying what we do at the state level, there are a lot of local programs that are either directly or indirectly trying to address homelessness and youth homelessness as well. So I would just want to mention, though, here that to help coordinate the state's efforts, while there is no single state department or body, recent legislation established the Homeless Coordinating and Financing Council, which is a work group whose goal is exactly that, to coordinate the state's activities. It includes stakeholders from various state departments and from local entities as well. And so coincidentally, actually, it is meeting today for the first time, and so hopefully some real fruits will come from that effort. So in my first bucket, I was going to touch on housing and homelessness programs that really are directly targeted toward youth. And the first one here I'd mention is the Homeless Youth and Exploitation Program that is administered by the Office of Emergency Services. This is a $10 million grant program that was established in, well, it dates back to the 80s, but it was recently, its funding was augmented in recent years and extended to a few different counties, but it provides a variety of services. Originally, it provided really supportive services around housing, but in the most recent augmentation, it actually does direct housing support, such as rental assistance, transitional housing, as well as the traditional services such as street outreach to individuals who are living on the street. Also targeted toward youth are a variety of child welfare service programs. As previous panelists noted, foster care children are highly overrepresented within the homeless population, and we do have a variety of state programs that are targeted towards ensuring that they're housed and ensuring that they can achieve the skills necessary to be sufficient going forward. So these do include the extended foster care that the previous panelists mentioned. In 2012, we extended foster care from age 18 to age 21, and that allows these youth to continue to receive payments, foster care payments, which may be about $900 a month if they're living independently, or to continue to stay with their foster care provider and receive housing through that. Moving on to page 4 here of the handout, AB 12, the extension of foster care, also included a new independent living option for foster children who may not have achieved a sort of a family connection, or who don't wish to continue living in group homes, but instead would like to live in their own apartment, in a dorm, in a house with friends, and so forth, and they can continue to receive foster care assistance until the age of 21 through that program as well. There are also transitional housing programs, which provide a much more robust set of supports to individuals, well, 18 to 25, but actually dating back to when they're 16. And so these provide one, housing, but also supportive services that will allow them to achieve housing in the future. And then finally, on the child welfare front, I'll just note that in 2016-17, the legislature provided an augmentation to the Department of Social Services of $10 million to establish a one-time grant program to help child welfare-involved families. This could include parenting youth, and so unaccompanied youth in that, according to that definition, and it is geared directly to help these individuals leave the streets and attain housing. Services that are offered through that program might include housing search assistance or rental subsidies and so forth. The next bucket of programs that I'll talk about, starting on page 5 here, are just state affordable housing and homelessness programs more broadly. Calworks, so for individuals who are on temporary welfare to work, the temporary welfare to work program, are eligible to receive support from a couple of housing-related programs. This could include young parenting youth and so forth. And these can either help house them if they do become homeless, such as temporary stays in a motel, or payment for a security deposit at a new place. And it can also help prevent homelessness to begin with. It is allowable to pay back rent, or to provide sort of counseling and support in dealing with a landlord with which there was conflict and so forth, to help them not have to leave their homes. Recently, there were also a couple of state bond initiatives that were passed by the legislature that are expected to provide significant new funding for permanent housing construction. These include the No Place Like Home initiative, which will provide permanent supportive housing for homeless individuals with mental illness, as well as the Veterans and Affordable Housing Bond Act, which would provide $3 billion for the general population to construct or rehabilitate affordable housing. And then lastly here, I would just mention the low-income housing tax credit, which does help builders finance low-income housing or affordable housing, and in recent years have yielded about 3,000 to 4,000 units statewide. So finally, I'll just touch on really programs that help to indirectly address youth homelessness. And these include the cash assistance programs that many of you are likely aware of, including Calworks cash grants for individuals who may be out of work or who earn what is really insufficient to live on. And this could provide a youth with a single child up to about $575 per month in cash assistance. Also, there's cash-like assistance in the form of CalFresh, or what's traditionally known as food stamps, which, while not obviously paying for any housing, can relieve families of a very significant budgetary item and free up funds that they can instead use on housing. And then finally, youth do qualify for supplemental security income if they are determined to have a disability, and these can support their housing costs as well. Finally, the state's Medi-Cal program provides a lot of physical mental health, behavioral health, in terms of substance use services that can help individuals achieve both stability if they're facing a mental health condition, or to return to work if they have a physical ailment. And this can help individuals, especially youth, not end up homeless or return to housing. And here, under the Medi-Cal program, I would just quickly note new programs that were implemented really beginning in 2016, which are called whole person care pilots, which are pilots that are really designed to coordinate the physical, mental health, and other supportive services, including housing services, for individuals who really utilize programs across our various systems of care. So for child welfare involved families, or for individuals who are showing up in jails, and are, to some degree, that is the only housing that they have available. And so these programs are really for local pilots to develop a lot of the infrastructure that's needed to, one, identify who these individuals are, and then two, to coordinate the services and get them in touch with the services that they need. So I ran through those awfully quickly, but happy to take any questions that the committee may have. Thanks.
Actually, this is more of a general statement, because what I hear, and this is what I heard, we have folks on the ground that are trying to help the youth. Our folks over here collecting data, giving statistics of what we can do. I heard that we have states that have solved some of these issues. I heard all of the different programs that are available, but I heard from Alexis that she wasn't able to access any of these. So there's an obvious disconnect between what we're hearing and what Alexis's experience is. So I commend you for the information that you're providing, and it sounds great, because if he was just doing the presentation, I'd say, oh, look at all of the great things that we have available. But how is it, and this is, again, more of a general statement than it's that Alexis couldn't access any of these programs and struggled so much. So I hear solutions or potential solutions with money available for all of these programs, but there's an obvious disconnect if Alexis can't access any of those programs. And I also heard that about 150,000 of the youth, the homeless youth, is in California. So I'm assuming that they're not able to access all of the wonderful programs that we're talking about. So I think, I don't know what the solution is, but I think we're all hearing the same thing. I mean, I'm excited to hear all of the programs that the state has, but why is it that Alexis can't access those? And so I also heard that there's potential best practices that can be implemented to address these. So how is it, and again, rhetorical, because obviously we're not going to solve this here, but how is it that we can provide all of the access to those programs so that Alexis wouldn't have struggled as she did those many years? And I'm sure that there's kids that are struggling right this minute. So how is it that we can connect all of this so that we can move forward to solving these issues? Again, we're here because of that reason. But I'm hearing really positive things, but yet the access to those programs are not available. And any ideas or any suggestions or anything that we can do as the legislature to try and connect those to Alexis?
I mean, I fully agree with what you're saying and what you're hearing. I think where there's a lot of things that we could say about why this isn't working as well on the ground. A lot of it has to do with us putting the onus on the person who's experiencing homelessness, on the young person that's experiencing homelessness, to figure everything out themselves and to go from program to program, knock on doors, see whose bed's available, see who has a case manager that happens to know somebody else who might have a housing spot, hope that that is a low barrier place that's going to be attending to that person's needs and not just say, nope, not here, you have to move on, and you figured out here's a number. And so it's not that there aren't really wonderful providers who try to take care of the whole person and do what they can, but with the scarce resources, providers also can't sort of figure out the whole system on their own also. So the coordinated response that we are promoting at the federal level really has a lot to do with addressing what you're talking about, which is connecting these resources in a meaningful way on the back end, which requires a lot of partnership, so that the person experiencing homelessness is at the center and that the onus is not on them to figure out what they need. Coordinated entry is something that LA has spent a lot of time, as has the rest of the country, but LA has spent a lot of resources and investment in something called coordinated entry, which is to really help build a system so that the onus, again, is not on the person, but is on the system to help bring the person in, make sure that they're quickly connected to the right resources. Those resources have to be available. So I think one huge problem is the scarcity of interventions. The state funding is going to be helpful to that, federal funding is, but those interventions have to be there to scale. If people are coordinated into entry but have nowhere to go, you don't want to prioritize people to nothing. So that coordinated response and having the scalable interventions at the back end and everything being very low barrier so that people can access all of those things no matter where they're coming in is really important.
And a question, and this obviously for future for our LAO's office is, I heard all of these different programs that are available. Is there a way we can find out how much money is actually being used for the services? Because you talked about programs that I had no idea existed. And so if we don't have any idea they exist, are they actually being used, or is that just a budget? The $10 million, is it just there for somebody to access and it's never been used? And so is there a way to figure out, of all the programs that you spoke about, how much money is actually going to services?
It's actually quite a difficult question to answer.
So
certain programs, do run through the state budget, and so we can readily identify them. A lot of them are either realigned to the counties and local funding, or state funding that we just send down to the counties, and they have flexibility over whether or not they use them on homelessness programs or not, and so it's really difficult to track.
Right. Well, and see, that's where the problem is, because like I said, I was really excited about the presentation about all these monies that are available, but then if they're not being used for the purpose that they're being designated for, then that's just a budget number. And so that's, I think, also a problem of us trying to deal with the issues. I'll go ahead and leave it open for somebody else.
May I add a comment to that?
Please.
I think I touched on it briefly, and I expect some speakers to speak about it later. Where we have seen some success in this area is where the state has taken some responsibility to put a framework and structure around this. I think a lot of the solutions we have in California are regional, or they're county-based, or, if I may say so, the money's in the wrong department. It's not reaching people like Alexics. Because just as a service provider, I could go down this list and I could tell you where I know there's money, but we can't get at it because it's been serving other populations, which are close, but they're not quite the population. But I do think this is where the state could help a lot, is implementing a framework and a structure, and I think that people will talk about the idea of perhaps an office of youth homelessness that can coordinate all these efforts and do exactly the work that you're talking about there, to actually see what is available for these young people, to see where that money is being spent, and to coordinate the efforts, coordinate the resources, implement best practices right across the state so that we really have some effective interventions come into play. Thank you.
Thank you. I have a question I think would be for Ms. Patel. So in terms of couch surfing, which you talked about, and we know there's a lot of couch surfing happening, can you talk a little bit about, first of all, how do we count that? It seems really hard when we do the traditional point in time count. You go out on the streets, you go to places where it's not perfect, but at least you can get a general sense. Couch surfing is obviously much harder. And also, how would you really define couch surfing? We probably all have different ideas of what that is. Does it mean that you need to know the person? Does it mean when people are exchanging sex for shelter, does that qualify as couch surfing? I'm just curious to know the thinking on that.
Yeah, no, those are all great questions. So I'm going to answer it this way. I think certainly when you do the point-in-time count and you're trying to capture folks in known shelters or known locations or on the streets, there is a large segment of the population that we know we're not quite reaching, that hidden population that either doesn't want to be found or is very challenging to find. So one of the ways with our methodology, and I should say up front, and we want to be very transparent. This was the very first time we did this in this country. We didn't get it perfect, and we're going to put, as we release this information, we're going to put everything out there for everybody to scrutinize and say, yeah, you did this well. Next time, let's do this a little better. But that's just to sort of preface and say, the way we tried to get to that, and we're gonna release that information along with the national survey results, is we did a national household survey of 30,000 plus households across the country. And because of how populous California is, we're actually likely going to be able to say something more about California than we might other states, and that's why I welcome the chance to circle back with you all. But what we did was contact those households. We partnered with Gallup in this instance, and we asked them about if they'd had a young person in their household, if they were a young person themselves within that age range who had experienced instability over the last year. This first go around, we didn't narrowly define what we thought couch surfing was. We asked them, and it really did depend on, did they themselves consider being unstably housed? So it likely fell into all of those different categories. I think as we get better at this over time and figure out how to ask those questions in a more refined way, we'll get there. And we'd like to get there. But as a first out the gate, I think we're going to be able to at least give folks an idea of how do people themselves, identify as having been unstably housed or having couch surfed, and it likely is all of those different circumstances.
I do want to commend you, and Mr. Costello, I appreciate your comment, because I hear the frustration from my colleague that we know there are resources, we know that's in the budget, but if it's not getting to the people who need the resources, then because we represent the state, we're failing. And in having a hearing such as this, it's trying to find those best practices that you've just talked about so that we then can move forward. We know there's a problem. It's been studied, sometimes it's been studied correctly, sometimes not so much so, but we know there's a problem, and we know that we haven't addressed it. And so this is a great beginning, and I do applaud you for the work that you have done and the efforts in helping us to better understand it. But I think that as we represent the state, trying to figure out ways that we get the resources, get the correct amount of resources, but then get the resources to those who actually are providing the service. I will tell you that a pet peeve of mine is when we say, well, we're going to put this amount of money into something, and instead of getting the money to those who are providing the service, we hire somebody from out of the area, pay them a big consultant fee, and bring them into our communities and tell them, would you please study the area and tell us all about it? And there go the millions of dollars, instead of using the money with those agencies, those groups that are already providing the service. So trying to find that, for me, is going to be the most important part.
Through the chair, I want to touch a little bit on what Assemblymember Rubio said, and my question is to you, Alexis. First, thank you very much for sharing your story with us. It takes a lot of courage to do that. We appreciate that because it helps us understand the situation better. My question is, two things that you said to me really stood out. One was that you tried to find counseling. Most people your age, most young people, wouldn't try to find counseling. So I applaud you for that, but then we have failed because we didn't have that available to you. And what Assemblymember Rubio said is for you to find those services, if we had them in school for you, do you think that would have helped you connect with those services? In your experience, how do we connect you with these services that we have heard about?
what's funny is that many of those services that were actually told, I've never heard about, which was something that really caught me by surprise because it was something that, knowing that even between 18 to 21, I could have been getting help and that wasn't even thrown out my way. It's much more of a pressuring, thought that I'm now thinking of because it's like, not only was it that programs weren't there now, and then counseling wasn't there either. It's like, it would have been helpful. It would have been very helpful to have during schooling. It would have been very helpful to have as soon as you get put into the especially foster care system. I was very young. I was 14, 15, 16, trying to figure out what the heck I'm supposed to do right after because I didn't know what exactly to do. And then maybe having a therapist or a counselor or something being there to calm me down, to, understand me, it could have got me through so much more than I would have thought about. Because, having to realize that, yes, I'm in foster care and yes, I'm supposed to be getting help. I'm growing up much younger than I should be. Like, I don't know what else to do but basically grow up and basically say, screw my teen years because I don't know what the hell else I'm supposed to do other than survive.
Right. The other thing that you said that really struck me is I knew who I was. And I think that is really important for all of us to realize that our LGBT community, they know who they are. As a mother of a gay daughter, she always has known who she was. And my job as her mom was to just continue to love her exactly the way she was and is, and I always have. But that helps a lot to know that we need to do a better job of making sure those services that are available in school, and then when you are a foster youth, to make sure we're telling you what is available to you. Thank you. Thank you, Mr. Chair.
Okay, great. I want to thank our panelists. And again, if you're willing to, we would love to have especially statistics in writing. That would be helpful. So thank you. I'll now turn it over to Chair Rubio for the second panel.
Thank you. Next panel is identifying and addressing the needs of youth who have experienced homelessness. If the next panel can please come up. We have Walter Phillips, Chief Executive Officer of San Diego Youth Services, Jessica Russell, Peer Counselor, Homestart Maternity Shelter Program, Nova, a young person who lived through a homeless experience, and Cheryl Adams, Executive Director of Larkin Street Youth Services. Welcome and thank you very much for being here.
Thank you for having us. Good afternoon. I want to thank Senator Wiener, Assemblymember Rubio, Assemblymember Reyes, and Senator Leyva for really taking on this critical issue, and it really is a crisis we're facing with our young people. Again, I'm Walter Phillips. I'm the CEO of San Diego Youth Services, and we provide a wide range of services for homeless youth as well as foster youth in San Diego. Also the vice chair, one of the vice chairs for the California Coalition for Youth, and we've been addressing this issue for decades, so it's really nice to see that there's some momentum being taken to really take this seriously in a very important way that we can expand our knowledge and resources. I want to start off by first maybe just talking a little bit and maybe clarify some of the issues around the funding and the gap of why are these resources not going to our youth. And I wanted to clarify something. It was a great report by the LAO, but in terms of the reality on the ground, for those of us who've been doing this, I've been working with homeless youth for over 20 years as a social worker and as a CEO, and we see that there's a difference between those youth who are in the foster care system and child welfare system, and you notice in the budget a lot of those dollars are there. There's $2 billion, in the child welfare system. For the past 30 years, in terms of those youth who are non-system youth, those are youth who have never been in the system, so they don't have access to THP Plus or extended foster care or even services when they're under 18. The state has invested about $1.1 million for 30 years. That $10 million figure last year and this year are one-time funds that has just come into effect. So I wanted to make sure that that's clarified when we talk about where are those resources. They really haven't been there for the non-system youth, and I think that that's important that we call that out because there are youth who, as you'll hear in my report, many of the youth we see in our programs have not been through the system, and we wonder why that is. I wanted to start off by talking about this not just being a housing issue. I know that housing is important, and the housing first philosophy is something we want to embrace. But in our programs, we have a drop-in center for homeless youth, and they come in. We have shelters, we have transitional housing, we have foster homes. There's a lot of unmet needs we're seeing with these young people besides housing. There's a lack of life, educational, vocational, and readiness skills. So these young people are really, whether they've been in the foster care system or not, oftentimes those skills are not there, and when they come through our door, they're not ready to maybe be able to live on their own housing. There's a lot of undiagnosed and untreated mental health and substance abuse issues that we're seeing in our young people. That's another issue that we have to make sure, as we're looking at a continuum of services or a system, a coordinated system of how we address this issue, we have to make sure we're addressing the needs as well as the housing. Oftentimes, these young people have an inability to regulate their emotions and have poor boundaries, so they engage in very poor and unhealthy relationships. You see a lot of domestic violence issues. We have that oftentimes in our housing programs where the police are out because of the poor choices and the lack of ability to develop healthy relationships. I talked a little bit about, and you heard from Alexis, and I wanted to commend you, Alexis, for your courage for speaking about your story. But there's a lot of struggles with our young people around their sexuality and their gender identity, and those are things that, again, are not a housing issue per se, but we face them, and it does affect their ability to maintain and sustain in housing. And finally, we talked about what's happening for these young people. They're couch surfing, they're bartering, they're on the streets, and so it's something that's been unmet, especially for non-system youth. I want to stress that. There are a lot of issues, also for our system youth, but non-system youth have really taken a back seat, not only in the state, but I think, our local areas as well. Senator Wiener, you talked in reference about youth being hidden, and Sonali, I think she had to leave and catch a plane, but about, that homeless youth are fluid as well. So it's very hard to count young people. So we've had a very undercounted population nationally as well as statewide and locally. They oftentimes blend in, look like any other teenager on the streets with a backpack. They don't want to be. I have a colleague in San Diego, and he says, the young people are not standing on the street corner saying, count me. That's not, how we identify them, so that's difficult. They just don't fit that stereotypical image of a homeless individual that we see pushing a cart or standing on the street corner. And many of them are with our children in school. They're just sitting next to them, and with a backpack studying, and we don't even know that they're homeless. So counting homeless youth is challenging. We were fortunate enough to be one of the 22 counties that were part of the Voice of Youth count in San Diego, and one of the 5 in the nation that had were in-depth interviews. And so I want to share a little bit of the information we gleaned from the count that we had in San Diego. And they do mirror some of the statistics that I think you've heard about nationally from Sonali, from Simon, and what's going on in LA. One of the things that you heard is that many of these youth are unsheltered. In the count, in our count in San Diego, 33% of the youth were sheltered, which is actually overrepresented compared to the other 22 communities where 48% were sheltered. We had about a 40% of our youth were either African American or multiracial, so a very diverse community in San Diego. One thing we've touched on, but not a lot, is 40% of our youth that were counted in San Diego were either pregnant or parenting. And that's an issue that we need to really pay attention to and address as we're looking at that. Again, we had about 20% LGBTQ youth, and about 33% were from foster care system. That means 67% were not in system and were not receiving those resources. We also did a provider survey. That was important to kind of get a sense of what was happening for providers. In San Diego, we had twice as many providers serving youth than the other 22 communities, which sounds that's great. But most of our providers have to turn away youth. We have waiting lists. At the time of the count, we had 0 beds available for 18 to 25-year-olds when they did the survey. So that means if you're a 19-year-old and you're looking for a bed, there weren't any beds in San Diego for you. In terms of the in-depth interview, and I know this has been touched upon in terms of some of the risky things that we're seeing with our young people is we had 1 in 4 of our youth that were identified in in-depth interviews exchange sex for a safe place to live. And that's something that we're seeing, and I'll talk a little bit more about the risk factors there. We have an incredibly, another issue in San Diego where we had 1 in 7 of our youth were crossing the border. So we have some, border issues that we have to deal with in San Diego as well. And then Sonali touched on the issue around the trajectory of instability that led to homelessness. And we saw that 9 out of 10 that were interviewed in our in-depth interviews were couch surfing at some time before they ultimately ended up homeless. So there was, again, how do we find them? Senator Wiener was asking that question. How do we find those homeless youth and intervene before they actually end up on the streets? Some of the lessons we learned was that homelessness is a very multifaceted and complicated issue. That we have a diverse community in San Diego and really have to pay attention to our diversity with African American, especially in LGBTQ youth, and that we need to find a strategy that's regionally developed and developmentally appropriate for our young people. One of the things that came out of the count, which is not about the numbers, was really about the methodology, and how do we go about identifying who's homeless in San Diego. So we applied the methodology we did in the summer of 2016 to our count this last January in San Diego. And our numbers increased by 39%. So we had 1,150 youth were counted as in the point in time count, and that was a 39% increase. Did we have 39% more homeless youth on the streets of San Diego? Probably some combination of that and just a better methodology of counting them. We've talked a little bit about, and I want to talk about some of the risks that our young people are facing when they're on the streets. We talked about how youth become victimized. They're very high risk of being victimized around the streets. We gave you the number in San Diego of those who are exchanging sex for just meeting basic needs. And that the data shows about 1 in 5 of young people who are homeless engage in survival sex. They're very, very at risk of commercial sexual exploitation. 60% of the CSEC victims were either homeless or runaway or were what sometimes called throwaway kids. So that's a very high percentage of those who ended up being forced into being sexually exploited experience homelessness. They're exploited by gangs and drug dealers. I talked about the mental health problems. The incidence of mental health is about 2 times higher in the homeless youth population than the general population. And we see about 70 to 90% of youth who are on the streets are involved in some kind of substance abuse. So what do we do? What can we do? We did talk a little bit about the state funding, and it's really important that we look again at housing and services in combination, that there be a continuum of age-appropriate and development-appropriate services. And I have a list here, but it includes street outreach, crisis intervention, case management, mental health and substance abuse counseling and treatment, educational supports. We have to remember many of our young people either didn't finish high school or still going through high school, didn't get a GED. We need to pay attention to their educational needs, employment training and readiness, parenting skills. We talked about that 40% of our youth were pregnant or parenting in our count. Life skills training, housing navigation, and just navigating the system in general. Alexis talked about not knowing where to go, and nobody really could find resources for her. And then family finding, that's another thing. How do we connect these young people with people in their lives that maybe they've been disconnected to? I think we oftentimes lose focus of that. Finally, I want to talk a little bit about the Housing First philosophy, and then I think we all embrace that in terms of making sure that there are low barriers to entry across our system. I just want to emphasize that it's the philosophy and not a model. I think we have to be careful about applying adult models to our youth, and that although we embrace that philosophy and making sure that we have flexibility in services, as was talked about by a previous speaker, that we have to really understand that youth are different, and youth are developmentally have developmental needs that we want to make sure we address. A critical question, which I want to bring in, it might be a controversial, and I don't think there's agreement across the board, even amongst youth providers, is should service participation be required? That's, I think a question that you heard one of the speakers say, as part of the Housing First model is no, this should not be required. And And I think that if we look at a model that's been working in California, the THP Plus foster care and THP Plus programs, there is a requirement for productivity. That's been something that we have to look at. So I think we need to think about that really seriously. I personally believe that there needs to be some level of service engagement with the young people. I've raised 3 young adults now, including a foster child, and developmentally they need guidance, they need support, they need structure. To put a young person in an apartment and say, good luck, you don't have to participate, and we've worked with hundreds of kids in our program, doesn't seem to work. So I think, we need to engage our young people at a level they're again, with low barriers, but make sure that they have those resources available to them and that we are really working to get them involved in those services, because oftentimes, we want to make sure that it's youth-driven, but we also want to make sure that we're available for them and that we're providing some structure for them as well. Again, we want to make sure that there's a continuum of housing options, shelters, transitional housing, rapid rehousing, rental access for affordable housing. That's a big issue. I know in cities like San Francisco, Los Angeles, San Diego, housing affordability is a huge, huge problem. We can get them through some of our programs, and then where do they go? They can't, the rent. My daughter pays $2,000 a month for a small 1-bedroom apartment in San Diego. So, it's cheap in San Francisco, right? But in closing, I just want to reiterate that we need to create an age and developmentally appropriate, coordinated continuum of services and housing options for our youth that meets them where they're at and addresses their individual needs and differences. Thank you.
Hi, 1 second. I'm Jessica Russell, and I'm the peer counselor at the Homestart Maternity Shelter Program in San Diego. I'm a former recipient of Transitional Age Youth Services. I grew up in 3 different households because my parents were never married and my grandparents primarily raised me. My father had joined the military, and I only spent holidays with him, and my mother struggled the majority of my life with her drug addiction. I was suffering from undiagnosed mental health issues, and I'd become self-medicating with illegal substances. Eventually, I found myself in a very abusive relationship with 2 small children. I had become homeless when I was 16 because I ran away and basically stayed wherever I could for as long as I could. I didn't find a stable home to live in until I was 21. During those 5 years, I had become a mother to 2 children. In 2013, Child Welfare Services intervened and said they could save my life. They told me that I could live a better life and give my children a real childhood. However, I still struggled with illegal substances and homelessness while my children were wards of the state. In 2015, I was finally able to realize that there was hope that I could live and provide this better life. I found this hope when I found Homestart. This program is an 18-month transitional living program with wraparound services, in which I was given my own apartment. I received intensive case management, therapy, and various forms of parenting education, all in my own home. Within the first few months of my stay at the Homestart Maternity Shelter Program, I was able to gain complete abstinence from all mind-altering substances because my mental health was adequately addressed. In the first few months, I was also able to gain trust from Child Welfare Services, and I was allowed to have my children in my care, unsupervised for half of the week. Because of the therapy services that were given to me and the support groups offered on-site with the other moms in the program who had been through what I went through, I was able to realize who I was and what I was worth, which led to me being able to officially let go of an extremely toxic and abusive relationship. In 2015, while in the program, Child Welfare Services closed my case, and I was awarded custody of my 2 children. Sorry.
Don't be sorry.
Towards the middle of my stay in the program, the peer counselor position with Homestart became available, and I was encouraged by my case manager and my therapist to apply for the position. October 1st, 2015 was my first official day as the Homestart Maternity Peer Counselor. maternity shelter peer counselor. I continued to work on myself and allow the program to help me become a better mother until my official exit from the program in August of 2016. My CEO encouraged me to push myself and be the best I can be so I can really make a difference. In 2016, I was elected onto the HomeStart Board of Directors and continue to share my thoughts and experience as someone who receives services and now provides them. My CEO also encouraged me to join the Board of Directors for the California Coalition for Youth so I could make a difference with all of the homeless and disconnected youth in all of California. I continue to serve on both of these boards, and it feels amazing to know that I'm truly helping myself by helping others. This program gave me hope of a better life and the strength to do the work necessary, and it's such an honor that I will now get to do that for other moms that come through our program. Dealing with the transitional age youth population can be tough for a variety of reasons. One of them that I have personally witnessed to be most prevalent in my 2 years as a peer counselor for this population is resistance. However, at the maternity shelter program, we have an incentive system that we call the Mommy Point system, in which clients are given a certain amount of Mommy Points for attending support groups, case management, therapy, and parenting classes. These Mommy Points then become actual money that the clients can use to buy things that they need. Some of the clients that I encounter have been in and out of different systems the majority of their lives and seem to have a hard time trusting the staff. I have heard several clients express their fears of staff getting close to the client and then leaving. I've also come across several clients who don't want anything to do with the staff because they haven't been through what the client has been through, and the client feels as if though the staff will judge them. It is important to remember that this population is so vulnerable, whether they express it or not. We're dealing with young people who may have never received the right kind of love or attention their whole lives. I know that I personally became a product of my environment, and I didn't know I deserved to live any other way. It is our job to help our clients realize that their potential is limitless. Instead of products of their environment, we need to find a way to help them become products of their investment. It is not our job to place judgments on this population because of how they were raised, what they've done in their lives, or what kind of statistics are being placed on this population. We are in the business of changing lives, breaking cycles, and changing the statistics. However, there isn't adequate enough transitional age youth specific training. I feel this is such a special and vulnerable population that there needs to be more resources available as to how to help this population the best that we can. The attention that this population has been gaining lately is incredible, and I know that as more and more people hear the stories of these youth, the more support we can get to change more of their lives. I'm so honored to be a part of something like this. It's a humbling experience to come into work every day and help those who are struggling the same struggle that I did. I know that telling a little bit of my story is helping to make a change, so thank you all for taking the time to listen.
Hello, everyone. My name is Nova Mone. I am 22 years old, and I am from Los Angeles, California. My homeless experience started when I was 14 years old. I'm short, sorry. Yeah, I don't think I want to go. Okay. My homeless experience started when I was 14 years old. I was living with my mother, who was a single mother, and while living with her, I was subjected to multiple types of abuse: physical, mental, emotional, you name it. During my teen years, we would argue and physically fight because we just didn't get along. Sometimes to the point where I would have to fight for my life. It was just a really unsafe space for me. So at 14 years old, I ran away after my mother hit me for the last time, and I hit her back. I remember walking all the way from mid-city Los Angeles barefoot and alone to go to my grandmother's house for safety. And when I got to her house, I told her about how my life was at home and that I did not want to live with my mother anymore. From that point, I ended up living with my grandmother and my father and his girlfriend on and off until I was 18. During that time, I moved around a lot, which was very hard for me to deal with. So I lashed out at family, usually getting kicked out of whatever house I was invited into. For most of my high school years, I struggled with depression and I dealt with instability. And I was dealing with all of this while still trying to stay in school. My grades were terrible. My interest in school was declining because I didn't know how long I would have to stay wherever I was at. And I was really used to not having a home at this point. I remember being so angry because I felt like my voice wasn't being heard. I was always assumed to be the angry black girl who was always in trouble, when really I was reaching out for help. I knew that my teachers knew that there were some things going on with me, but they didn't take the initiative, or they didn't really care enough to ask. And I remember in my senior year, I missed my graduation because I went to the mental hospital for a suicide attempt and for self-harming. I got into an argument with my grandmother because she threatened to send me back with my mother, and I was so scared to go back that I physically tried to take my own life. Sorry. That was one of the most scariest moments of my life. I knew I didn't belong there. I knew that I just wanted support. Sorry, you guys. I just knew that I needed support from the people who were around me. 72 hours into my stay at the mental hospital, I was released to my father and his girlfriend, because at that point, my grandmother was sick and tired of my shit. I was always lashing out. I was always in trouble. I didn't know how to deal with the traumas that I was experiencing. I probably lived with them, thank you, in their house for about 6 months when my dad's girlfriend kicked him out. So we packed up and left, and I was back to square one. I was unstable again. Around this time, I was in a relationship with my first girlfriend, and I told her that I was homeless, and she asked her father if I could live with them. Luckily, he said yes. So I was stable for about a year. Eventually, her father kicked us out because they had a falling out about me living there, so we moved out and got our own apartment. Everything was great. I was finally experiencing my own home at 19. But 6 months into our relationship, it got violent, and I was a victim of domestic violence. So at this point, most of all my family disowned me because of my past fights with them and trouble that I would bring to their homes. So I had no choice but to stay in a toxic relationship for a year because I had nowhere to go. My girlfriend kicked me out of the house, and technically there was nothing I could do about it because my name wasn't on the lease. I couch surfed and lived with family that I had to literally beg let me stay for the next 2 years. I lived with people that I barely knew. I got into relationships merely for someone to lay my head, and I put myself in some very risky situations because that was the only way that I knew how to survive. So I just want to touch a couple bases on some of the things that have been said on the other panel and this. I just wanted to address the stigma behind Tay youth and homelessness. I am the Los Angeles Lgbt Center Chair Ambassador, so I speak to a lot of the youth, and we have conversations about things that we feel like need to change within the center and within or around the homelessness issue. And a lot of the things that I have been hearing is accountability. We feel like we're not being listened to. We don't understand how service providers are, their main job is they're dedicated to us and to making our lives better, and it's not being shown in the work and on the floor. We have all these statistics, and we know that there's a problem, but I feel like no one is taking it as seriously as it needs to be taken. There definitely needs to be more mental health resources, and I feel like trauma-informed care training so these service providers can know how to deal with us, because I feel like there's a certain stigma behind us. We're lazy, or we don't want to, we don't care about our future, and that's not necessarily, the case. We come from a lot of different backgrounds where we have been abused, we haven't been loved, and we don't know anything but how to survive, And it all comes back to accountability. We need for you guys to build a framework for these service providers. There needs to be a certain level of care, that is being implemented, because if not, it's not going to translate to the services that we need. And I don't find it interesting that a lot of these statistics are LGBTQ youth and Black youth, and that's a whole different, issue within itself. But there's definitely more of a need for accountability. So that's all I got.
I'm Cherilyn Adams with Larkin Street Youth Services. I think I first just want to really acknowledge Jessica and Nova for sharing their stories and their insights, and for being both willing to share that and also to really be honest about what we can all do better in the work, and for your leadership roles within the organizations that you now are working in. So thank you, and I get to work with you on the board, so that's great. So thank you very much for hosting this, Senator Wiener and Assemblyperson Rubio. We are really honored. As somebody who's worked at Larkin Street for a long time, Larkin Street's a program in San Francisco working with runaway and homeless youth. We've been around a really long time, and this is the most attention and discussion and interest in the topic of youth homelessness that we've had in a long time. Senator Wiener's been a longstanding advocate for the issue in San Francisco, but it is really incredible to see what's happening across the country and now in California, for us to really think about how we want to systemically address this issue. Youth homelessness does not have to exist. It does not have to exist, and we can change it, right? It is not okay. It is not okay that 80% of young people experiencing homelessness in this state sleep on the streets or someplace they should not be sleeping, right? Our investment as a state has been $1 million for the past 30 years until the most recent investments, the $10 million that came out a year ago and the $10 million that's not even out the door yet, right? It's not enough to change the lives and experiences of young people experiencing homelessness. We are doing great things here and great things that we can learn from in the state or in the country, and part of that is the HUD demonstration grants, where it is both about a systemic response, as some panelists have mentioned, right, that we do need to have a coordinated response that involves providers, it involves child welfare and juvenile justice and the school district and mental and behavioral health and housing providers, to be able to develop a response across communities that prevents, quickly intervenes, and resolves homelessness among young people. That young people, as we have heard from the panelists, are the experts of their experience. They need to be involved from the beginning to the end in the process. They know what they need. We need to listen, and we need to be much better at involving them in all aspects of the work. They know that they're their experts. Simple as that. What we also need to do, though, is we need to have resources invested in prevention, in early intervention, in scaling our housing opportunities, in providing a rich array of services for young people that we deeply engage with them in addressing their individual needs. We need to understand that homelessness among young people is disproportionately affecting LGBTQ youth and African American and Latino youth, and there is not, that's an equity issue that we need to address as a state. It's an issue that we need to address as providers and as communities to ensure that our services are meeting the needs of young people, that are addressing both the needs, whoever's homeless on our streets are getting into our housing programs and are getting the supports that they need. To do that, we need deeper investment from the state. We do need to coordinate. We do need to match the federal response. We need an office at the state level that's invested in addressing the needs of homeless young people, that can take and coordinate services across health and human services, across housing, across behavioral health, across workforce development and education. I heard a very smart man last week at the True Colors Fund conference talk about Voc Tech. We do workforce development that's about teaching people how to do a resume. We need to prepare young people to be in the labor market that is today, right? So that they get a job that they get to have and keep. It's a career, it's college, it are all the things that young people need, the same as their housed peers, in order to be able to successfully participate in California's economy, right? California's economy, which is healthcare, high tech, right? Transportation, hospitality, big jobs, careers. And we can do that if we invest. If we invested $100 million and we put some of that in front-end services for young people, that was prevention, family finding, family reconnection, improving our child welfare and juvenile justice and children's mental health systems so we don't exit young people into homelessness. If we expanded housing options to look like transitional, supportive, I don't care what you call it, you make it easy to get into and hard to get out of, right? That's what young people need. And then we need follow-up supports. They need education and employment and support skills while in housing and beyond. We need subsidies for them to exit into housing so that the affordability issue is addressed. Some people will need long-term in housing, some people will not. 1 in 5 homeless adults, chronically homeless adults, had their first experience of homelessness in, that's not even right. That's not even right. 50% of folks who are experiencing chronic homeless adults had their first experience of homelessness when they were a young person. You want to stop chronic homelessness? Solve for youth homelessness. I think that's all I want to say. We need $100 million, we need an office, and we need young people at the table. Thank you for your time.
If I could just interject, Cherilyn's my constituent and worked through a lot over the years, and I just really want to say that Larkin Street Youth Services does just such a tremendous job, getting kids off the streets in housing, and I just want to thank you for the work in San Francisco that you do.
We're done, right?
Question Well, thank you. Thank you very much for the information, and we look forward to working with you.
I'm sorry. I do have just one question for Nova. Sorry to put you on the spot. One of the issues that's come up repeatedly, and you sort of touched on it a little bit, is the difficulty counting homeless youth. Because people, you mentioned, I think, stigma, just people don't, as we heard before, people don't, young people don't want to identify as a lot of different things.
Right.
They don't want to be, pegged. And so how can we do better at counting homeless youth? I don't want to put you on the spot, but...
No, it's okay. I mean, coming from my own experiences, I couch surfed a lot, and I know it was very hard to tell people that I was struggling because I didn't want to be taken advantage of, and it was just embarrassing. I don't have a immediate answer for you. I'm sorry. But what I will say is, I guess starting from school, because that's usually where youth are for the first part of their life, having more of this information implemented, having teachers, trained on signs of these things and what that may look like and how to ask a child and or youth if they're going through something. Definitely, I think from there that can help. And like the young lady said before, we are transitional age youth. We are very hard to talk to because we're in our formative years and no one can tell us shit, really. But but I think it's training and how to know how to ask these questions. Because if I don't want to tell you, I'm not going to tell you. But if you show enough initiative and care, I just might. So like I said, I don't have an immediate or systemic response to that, but I definitely do think that there needs to be more training and more information on what this looks like. And yeah.
Great. That's actually really
Could I piggyback on that? Because Sonali didn't talk about it, but one of the key pieces of the methodology that Voice of Youth Count did was that it was youth-driven and youth-led. So there were youth teams and we used incentives to get youth, and these were youth who had experienced homelessness or even were homeless still. And so it was really important to engage youth, involve youth, and helping us identify what we call were hotspots, throughout our communities to where we can start to look and engage young people. And I went on the streets with a team, and I stayed in the background because young people are not going to feel comfortable with me coming up to them, but our young people who they might even know because they know in the streets, we're much more successful in having our youth involved. So I think that's part of an answer is making sure that, as Cherilyn said, we involve our youth in every step of the way. And that includes counting our young people.
Well, and if I may add, thank you, Nova, for that answer, because I taught for 16 years. I just left the classroom in November. But as a teacher, that was also difficult because you want to treat each child. In my classroom, I wanted to be a safe environment, so I didn't want to single out anybody. So I treated everybody equally so that they didn't feel left out. But that also meant that I wasn't necessarily looking for the signs, because if there was some trouble, if I had kids that were not behaving, I didn't want to single them out. So I didn't ask. I wasn't trained. I'm still not trained to ask, what's going on at home. And so that in itself, as a professional teacher, was difficult for me. When I think I told you the story earlier that I found out that some of my students were living in a hotel. It was my first experience dealing with vouchers. I had no idea that existed. And so when they said something about a voucher, I wasn't trained to respond to that child, or my job is to teach the children, right? And so my day was packed in lesson by lesson, trying to teach the kids and trying to get the best education for them, that everything else was secondary, which was a mistake, but I didn't know any different. And so thank you for saying that, because that is a huge component of this. The teachers are the first line of defense, I guess, if you will, if you want to use it that way. But if we're not trained to figure out or to pick up on the signs, then we're going to overlook that. And a lot of times, in a lot of those communities, I have a bill right now on preschool expulsions, that a huge percentage, we have 18% of the population of preschool students are African American, and yet they account for 48% of the expulsions. So the bias, even within the teaching community, is there as well. And so the ones that are open to the training will be great, but then we all come with our own set of biases based on the experiences. Nova, you touched on something really important that I want to commend you for, is you were lashing out not because you were a bad kid, but because you were reaching out for help. But when teachers are burdened with 32 kids in the classroom, and perhaps in the community that I thought 4 of those kids were lashing out for help, how does one person, without any training, deal with identifying the situations that the kids are in? And so there has to be a connection. You also said that there has to be a connection between the services and the providers within the classroom. There is no, and I find it really strange that even in the legislature or in the different programs, the silos that we live in, the education department is here and the social services department is here. and these have to be connected because the kids are going into the schools. And so if the social services department is here and the education department is here, we're never going to communicate. So thank you for saying that, and I encourage you to talk to your board and to other youth and give us ideas of what else we not only can do, but what do we need to know, because a lot of us don't know what you know. And we're busy living or trying to live that we're ignoring, not on purpose sometimes. We're ignoring the signs that you are talking about, and unless we have a list of signs or have some trainings for the teachers, we're never going to realize or know what you are going through. So thank you for that, but please make sure that you stay engaged with us, because this is why we're here. And I shared earlier that I don't want to talk about it anymore. I want to listen and do something about it. If you can help us with one thing that we can do, maybe next year we can identify 2 things and 3, and to eventually where we can solve some of these issues. So thank you again, Nova.
Okay, now I'd like to call up, I want to thank the second panel and call up our third and final panel on emerging solutions. We have 3 panelists, Shahara Hyatt, who's the director of the California Homeless Youth Project, Dr. Michael Scoggins, the director of housing for the Los Angeles County Department of Children and Family Services, and Peter Lin, who is the executive director of the Los Angeles Homeless Services Authority. Welcome.
Hello, good afternoon, everyone. Thank you all so much for sticking around. I know this is a room full of experts, and I'm sure that they're all excited to hear public comment. And thank you guys so much for holding this hearing. My name is Shahara Hyatt, and like you know, I'm the director of the California Homeless Youth Project. And our goal is to educate policymakers on the needs of homeless young people in California. We've been around for just about 10 years now, which I'm really proud of. And during that time, we've written all matter of publications on issues impacting young people experiencing homelessness, and have contributed to policy recommendations that have really changed state law to better serve these young people. In 2013, we released the nation's first state action plan on ending youth homelessness. It was called More Than a Roof: How California Can End Youth Homelessness. And so we really targeted I think policymakers, state agencies, service providers, and community members in our recommendations, and I think it's still a useful resource. So I wanted to, I think, maybe speak to some of the points that you all just brought up, since it sounds like there's interest in, sizing and scoping the population. The California Homeless Youth Project did a statewide technical assistance project to help communities across our state count young people experiencing homelessness. One of the things that I would say is that in our research on youth homelessness, we need to make sure that I guess the questions are really reflective of the problem in a way that also speaks to the challenges that the system is having, not just the challenges that the youth are having. So, I know in Sacramento's point in time count, they asked sort of like, why did you become homeless? And none of the questions actually spoke to the vacancy rates or the fact that Sacramento has seen, some of the highest increases in rent in the last couple of years. They were things like, do you have a mental illness? Do you have a substance use issue? Are you unemployed? And one of the things that I often say is that people don't become homeless because they have mental health or substance use issues. They become homeless because we don't have an adequate response for people having mental health or substance use issues. And I think especially when we talk about young people, family conflict is something that's come up a lot today, and I think that is a really huge problem. And I think it's also important to recognize how family conflict really gets exacerbated when families can't meet their basic needs. So if one family loses their housing and they go to live with another family who's in substandard, overcrowded housing, and they have a conflict with another one of their siblings or with their parent, there's not a place to cool off. Those kinds of things are going to be so much more heated. So I think about supporting families to make sure that they are getting their basic needs met to also help reduce that family conflict. When you ask a young person why they become homeless, that's often what folks will talk about, and that's very real, but also no young person is going to say because of decades of federal disinvestment in affordable housing. So we need to make sure that, I think, especially as policymakers, we're turning the lens back on us to say, kind of what are we doing to contribute to these kinds of issues, so that we're not just kind of pathologizing individuals or their families. The other kind of piece that was just coming up was around education. The numbers of how many students are experiencing homelessness in California are really astronomical. In the 2013-14 school year, it was close to 300,000, which was about 5% of our student body. We do have, homeless education liaisons that are in every school district across the country to really serve that community. Oftentimes, they have to wear multiple hats, so that can be really difficult. But I would say there's another kind of like greater missing I think, support system around college students experiencing homelessness. So I know that Senator Weiner spoke a little about that in his opening remarks, that about 1 in 10 CSU students are experiencing homelessness. There was just a national study about community college students experiencing homelessness, and 50% of them were experiencing some kind of severe housing insecurity, and fully 14% of them were unsheltered. So 14% of community college students nationally were unsheltered. That was huge. 30% were experiencing food insecurity, and in our state of California, 40% of community college students are experiencing food insecurity. So we really do have a critical problem in our state in particular, in what is definitely a national crisis. So I want to talk a little bit about, in order to talk about solutions, how do we measure success? And I thought it might be useful to use the U.S. Interagency Council on Homelessness has released some guidance around that. There's 4 primary goals. So what do we want for our young people in our state? First, we want stable housing. So a safe, reliable place to call home. Obviously, that's foundational for really any other development into adulthood or metric for success. The second goal that they've identified is permanent connections. So whether it's to families or other, chosen or otherwise, or to communities. I know that when we held focus groups with young people who are homeless and we ask them, what do you need to be successful? They talk about having a supportive, positive adult. And I think that speaks to the fact that these young people are not only experiencing economic poverty, but also sort of relationship poverty or the erosion of their social safety net. And both of those are really important. The third goal is social and emotional well-being. So I think that refers to the healthy development of social emotional functioning needed to successfully transition into adulthood. So that's kind of housing is one big piece of it, but then we also need the supportive services, supportive adults to make sure that they can be successful in housing or education or employment. And then the last metric they look at is connection to education or employment. And I would say meaningful connections to education and employment to make sure that it really can be a sustainable pathway out of poverty and help to break that cycle of homelessness for them. So some of the policy recommendations. So these are our responsibility. We need to prevent homelessness by supporting families who are struggling economically or emotionally with supporting their child. So, there's definitely the economic issue, like I said, of not being able to meet their basic needs. And then there's also what Simon and others talked about, families that are struggling with their child's sexual orientation or gender identity. So we want to see, state funding needs to be increased and ongoing. I think that's a huge thing I've been hearing throughout the course of the day, and I also really want to underscore that it's been really nice to see the increases in this current budget cycle and the last one, but that, $1 million or $10 million in a state the size of California is really what friends at the LAO call budget dust, right? It's really not a significant amount of funding to really help change course in our state. And I appreciated Cynthia's point, too, that what often makes a difference in communities to move the needle on ending homelessness is not just funding, but it's oversight and accountability. So I think that California should join other states like Colorado and Washington and Minnesota that have an Office of Homeless Youth Advocacy or a position that's designed specifically to oversee how we're addressing homelessness in our state. And with a population the size of California's, and especially a homeless youth population, I think that would be a really wise investment. I think the difference between 0 and 1 and having somebody kind of overseeing that would be huge. We need to look at legislation with the lens of these young people who are much in need of state attention and protection. We know there's a lot of overlap between homeless young folks and then youth in the child welfare system, in the juvenile justice system, undocumented youth. I think that when we're thinking about legislation, a lot of these young people, traverse many of those sort of labels or experiences and could benefit from similar rights or protections or services. So as intersectional as we could think as policymakers, that's going to make it easier for young people in the community to actually access the services if there are more doors that they can enter to be able to do that. Another issue I think that we need to address is undoing the criminalization of homelessness, which really disproportionately impacts LGBT youth and youth of color. So I guess for folks in the room, who knows, by a show of hands, who knows what I'm talking about when I say the criminalization of homelessness? Yeah, most of us really do. So when we've done interviews with over 200 homeless young people across California, their number one policy recommendation was to undo the criminalization of homelessness, which they saw as really exacerbating the issues related to their homelessness. So the recidivism rate for breaking these laws around sitting, standing, sleeping, loitering are really high because they're not criminal behaviors, they're human behaviors that when you don't have another place to do them, you're going to have to keep doing them. And so we know structurally in our communities across the state that if a young person is experiencing homelessness one night and they get a ticket for sleeping outside, they're really likely to do it again because our system is not that responsive, as we heard today. So we definitely need to take a look at that. And then building service capacity, as we've heard. I think engaging homeless young people in designing appropriate services that meet their needs and better serve all youth. We've done focus groups specifically with LGBT homeless youth, and a lot of them talked about, experiencing discrimination because of their housing or economic status, sometimes when they're in LGBT-specific spaces, and then experiencing discrimination because of their sexual orientation or gender identity, in the homelessness system. So they've really asked for services that are specifically designed to meet their needs and serve them well. And then I think an issue that we have, not just in California, but anywhere, is that, as policymakers, if we're coming from situations that are middle class or better, we might get the problem statement wrong about what's going on. So then we have solutions that may not meet the needs of the community that have unintended consequences. So I think that that, again, just kind of speaks to honoring the expertise of, some of the greatest speakers we've heard today, these young people with lived experience, and not just asking them to share their stories, but also incentivizing them, paying them to do that, because it really is work. Let's see. Yeah, and then, what does it look like when we don't help? We've heard a little bit about that today, but I think that youth behavior is directly tied to the ladders of opportunity available to them. So when young people aren't getting the support to meet their basic needs, they are incredibly resilient and resourceful. They'll participate in the underground economy. They'll become extremely vulnerable to sexual exploitation or labor trafficking. And those are the positions that we put them in when we don't give them alternatives. These aren't things that they're doing because they don't know the difference between right and wrong, or things like that. And it also means putting people that are working on the front lines of addressing this problem, like street outreach workers that meet the young folks where they are, in the very unenviable position of having to discuss harm reduction strategies around where to sleep outside that night, because they know that the shelters are full. So even in a place like Los Angeles, which is maybe relatively service rich, we know that every single day there are young people that are turned away from either emergency, transitional, supportive, or any other types of housing options. So, we believe that California can lead the way in ending youth homelessness, not just lead the way in numbers of youth experiencing homelessness. And I guess I just wanted to close a little bit with some people recommendations. Since all of us kind of have our professional hats on, but what can we do to really make change today? I think that's treating people experiencing homelessness with dignity and respect, sharing resources if you feel comfortable and able to do so. I think we need to challenge narratives that pathologize people experiencing homelessness. So when we're trying to generate the political will to be able to increase funding or open up programs in our districts, I think talking sensitively about who this community is and what they're facing in non-stigmatizing ways helps to generate that kind of momentum. Over 90% of homeless young folks we've talked to across California said they wanted to change their housing situation. So I think challenging myths around this is like a lifestyle of choice. And even for that 10% that didn't say that, we sort of believe that they're so disenfranchised by the lack of service and support that they feel like it's a dignified alternative to say that it's their choice rather than to say that, you accept that reality. And we heard Simon talk about some local data around, 70% of the homeless young folks in LA are from this area. That's true in communities across the state. 70 to 80% are generally from that community. I speak so much about homelessness, and a lot of folks think that we have a problem in California because we have lovely weather. That's not the case, right? We have a housing affordability crisis, and that people experiencing homelessness tend to migrate for the same reasons anybody does, which is connections to jobs, family, and friends. So I think with that, I'll pass on to the next speaker. Thank you so much.
Thank you.
Great. Good afternoon. My name is Michael Scoggins. I'm with the Los Angeles County Department of Children and Family Services. I'm the housing director in our Youth Development Services program. As you all know, our primary goal in Los Angeles County is child safety. At the same time, it's also providing self-sufficiency and well-being for our youth as well. Approximately, we have 34,000 children in care, and that number has been fairly consistent for the last several years. Actually, about 15 years ago, it was around 50,000. So we've done a better job at providing care for our youth and our children. Our transition age youth account for about 2,400 children right now in the LA County system. Approximately 800 or so exit LA County, transition age youth exit LA County every year. And we have four housing programs that is, to address closed cases as well as open cases. I'll start by describing the programs that we have, our housing programs. So the housing programs are for not only DCFS youth, but they're also for our probation youth, LA County probation youth. The first one is our Transition Housing Placement Program. It's a small program. It's been reduced over the years. We only have 6 beds right now, and those are for age 16 and 17. That's our THPP, Transition Housing Placement Program. For our Transition Housing Placement plus Foster Care, we have roughly 325, the number does vary. We have about 325 beds with various providers throughout LA County. Those are also for probation youth as well as DCFS youth. And it should be noted that not just the housing component, but it's also the life skills training, the self-sufficiency, and everything else that goes along with preparing a youth for independence. That program, the THP plus FC, is for our youth 18 to 21. Our third program is our THP IOP, and that's contracted with our provider, LASA, and they subcontract out to various providers. We have 175 beds also for DCFS and probation youth, and 50 of those beds are earmarked for mental health. So a total of 225 beds for the THP IOP LASA program. And then the last program that we have is the THP Plus program. We have 82 beds, and that's for youth from the age of 18 to 24. Those two programs with LASA and with the THP Plus, those are for emancipated youth that were former foster youth that were in the system. Youth could re-enter the program if they want to re-enter the program at any time. So that is also a possibility. So with the 4 housing programs, there's about a total of roughly about 650 or so beds for the entire LA County. What we're doing currently, we're piloting 3 programs right now to improve the housing crisis for youth. One of which is discharge planning. Discharge planning for in the SPA 3 area. For those that you may not be familiar with our language here, that's service planning area. And SPA 3 basically covers the El Monte, Pasadena, Covina area, kind of the east part of the county. So we're piloting a program to focus in on the discharging of youth in that particular SPA area. The second thing that we're doing is we're looking at AB 12 youth. That's Assembly Bill 12. That's extended foster care, as you all know. And that is in our SPA 2 area, our Service Planning 2 area, which covers the San Fernando Valley. And the third pilot that we're working on in collaboration with LASA is the coordinated entry system. And I'm sure you all have heard that this afternoon. That involves streamlining, doing a better assessment of youth that are looking for housing. So that's a coordinated effort that we're looking at with LASA to address the homeless issue with our youth. Now, we have, in Los Angeles County, we have 8 service planning areas scattered all around LA County, which I believe is about 400-something square miles. So we know it's difficult for our youth to go from place to place to seek housing. So we're hoping to have, and this hasn't exactly started yet, the planning has, the implementation has not yet, but we're looking to have one coordinated entry staff co-located with the Department of Children and Family Services Regional Office to help receive that youth coming into the office, to take their application, help them process it, doing a real intensified assessment to make sure that the needs of that youth are being met. So the coordinated entry system is something that we think is going to be really beneficial to the youth, and it's really going to meet their needs and do a better job of streamlining the process. We also have the Youth Development Services in my program staff that oversee all our providers to make sure that all our youth, when there's a possibility of them being terminated or leaving a service provider, making sure that they have an accurate and a fair case management, face-to-face, upfront assessment to find out what's going on, to find out with the provider what kind of problems can be corrected. So that's been going on for a long time. One of the other things that we're doing is with the difficulty in all the things that we do, and I'm not making excuses, with the social workers coming into the department, many of them being new on the job, less than 3 years on the job. There's so many things that they need to learn. But one of the things that we're going to be tasked with doing is a better job of discharge planning. We're looking at lengthening the time with the service providers, not just the service providers, but also the social workers at the department, of looking to helping that youth plan their future. What happens after you emancipate? What happens after you leave your current housing situation? What's going to make it better for you? What's going to be more beneficial for you? So we're looking at actually lengthening the discharge planning time, and also doing a much better job at tracking our discharges. One of the things that we're working with the on the homeless initiative, the LA County Homeless Initiative, is tracking where these youth are going after they leave foster care, after they emancipate. You know, many of them report just anecdotally, I'm going to live with my auntie, I'm going to live with my cousin, I'm going to live with a friend. So far, that counts for about 50 to 60% of the youth, what they actually say anecdotally. But actually tracking it, making sure that after 2 months, are they still with their aunt? Are they still with their first cousin? Where are they going? These are the things that are going to help us address the chronic issue of homelessness. I think there's a lot of things that are going on in LA County that are very good. We also have the continuum of care, the state's continuum of care, offering quality service. It may sound very, very basic, but when you're in a big bureaucracy, you want to make sure that all your frontline staff and your support staff, that they're adhering to the quality of care for our families, for our children, for our youth in particular. And also with our core practice model, is something that we started about 5 years ago in the department, is kind of getting back to basics and making sure that all the standard practices are from each office to each office, that things are consistent, there's teaming, there's engaging, and this is a way that we believe is going to help the youth that are at risk to avoid that possibility. I heard something earlier on the panel. I think the gentleman from San Diego talked about vocational training, readiness training, getting the youth ready. I think that's so important. We hear from our providers, our contractors all the time that a lot of youth are just not ready. They're just not ready. And we need to do a better job of grooming them, providing the necessary basic skills that they're going to need, for independence once they leave their housing program or once they leave the department and emancipate. So those are some of the things that we have going on in LA County. It's very encouraging. I'm glad to see the homeless initiative being implemented countywide. It's allowing us to take a second look at what we're doing, our practices, and hopefully working with LASA and doing a better job. Thank you.
Thank you. I am very pleased to be able to speak to this, and I guess I'm sort of batting cleanup here, so I hope I can do justice to that. Thank you to the Senate and Assembly Committees on Human Services, Chairs Rubio and Weiner, I'm Peter Lin. I'm the Executive Director for the Los Angeles Homeless Services Authority. LASA is a joint powers authority between the City and County of Los Angeles, and we are the lead agency for the County of Los Angeles in the application for federal assistance, with the exception of 3 of the cities that run their own continuums of care. But we also administer city, state, and local funding for county programs and city programs across the county. So we have a responsibility for implementation of a variety of measures. Obviously, homelessness in Los Angeles County and California in general is at a crisis proportion, and I think that you could judge that by any metric. Walking outdoors in Los Angeles, looking at the counts and the increasing numbers of people who are experiencing homelessness in the county and the state. And I think that the people of the County of Los Angeles obviously took note of that in voting to tax themselves to put together, Measure H and put together a pretty comprehensive package of services. I still, we have a ways to go to implement all of the measures that the funding just started in the summer. We're going to step that up pretty significantly. But I want you've heard. Part of the challenge of the complexity of addressing homelessness, which is probably the most complex social challenge that we face in America and in California, where it's at a particularly acute crisis level. I wanted to talk about 4 things that we're doing locally, and to just kind of walk through some of the solution set that we're looking at. The Youth Coordinated Entry System is one of those, and I wanted to speak to that particularly because of the innovation that it represents to pull together the collaborative framework of providers and services that we have, but also because it is with this infusion of resource, we have the ability now to take several different service components that have not been funded to real scale, and I think that there's something really promising about that. So, building on the model that we developed for our single adult coordinated entry system, which has obviously many more providers and there are many more single adults experiencing homelessness in Los Angeles, and our family system, which has a much more sort of centralized approach, we launched the Youth CES last year. That included funding for the first time. We brought together a collaborative approach to the funding application so that each region, as you heard Dr. Scoggins articulate, there are 8 service planning areas. Each region was asked to come together with a community plan, identify a lead agency that they wanted to be the sort of central host for the coordinated entry system in their region, and that would play the part of funding for coordination of all the services that emerge in that region. So each region identified a lead agency. Those agencies were funded for that activity. It was often the case that we ask people to do collaboration and meetings and so forth and don't fund the activity. So we actually put money up for that activity, their staff positions funded, so that they can pull together and do the kinds of case conferencing. The basic concept is that we have invested over the years, not at sufficient levels, but certainly at some level of investment in service providers, and have developed a cohort of really world-class service providers that do not have any systemic linkages across the provider framework or with the rest of the sort of large mainstream infrastructure that's represented by, an agency like Department of Child and Family Services or Department of Public and Social Services, so that there are large mainstream systems that are not connected, and there are lots of individual standalone programs that do a great job in their specific area, but there's nothing that connects them to a broader system of pulling people off the street and getting them placed into housing. Particularly if you have one shelter, we often would have, a shelter infrastructure that standalone, had no particular connection to other services or other housing placement. Often would use individual metrics and rubrics for placing people, assessing people, and putting them into the services that they have. Instead, we've identified a common assessment platform, a common assessment tool that we're all using. It's called the Next Step tool. It draws on learning from a few different kinds of instruments of assessing, the vulnerabilities and needs of people. We agreed to that as a framework. Part of it was developed by Eric Rice here at USC. Part of it was developed by OrgCode, and that went out to be used across the assessment for all youth in the continuum and help to assess their needs and triage them for the services and the housing resources that we have. We were able last year to deploy about $5 million in local money for that regional coordination for a first-time rapid rehousing program for youth. Rapid rehousing, you've heard a few different housing models. Obviously, there are a few different interventions that have been developed over the years that, the evidence has determined that they are really best practice. One of them is permanent supportive housing for people with pretty severe social, service needs and mental health, physical health, and substance abuse service needs. That's usually reserved for folks who have been chronically homeless. Youth don't usually have the length of time homeless that is figured there, so there are other metrics that can be used for that. There's transitional programs, which are fairly structured. They offer a basket of services and sort of on-site, time in a structured environment for a period not usually exceeding 24 months. That's a sort of old school federal definition of a transitional housing program, although, youth programs can sometimes go longer than that. One of the challenges with that model has been the barriers to entry and the programmatic, you can violate program rules and lose your housing, and that's a significant problem for folks. So there's been a significant amount of work to reduce barriers and turn those into housing first models, and that's ongoing. In between those, there's a model that has developed reasonably good traction. We've been using it locally for families for a long time, which is called rapid rehousing. And it is the idea that a lot of folks need a sort of financial boost, connections to employment services, connection to education services, but they don't need long-term assistance. They can actually do perfectly well in the rental market with case management services through that process and for some period of time afterwards, and then they're sort of move through that. So we put together a pilot for youth in the using rapid rehousing dollars, and that last year was the first time that we had that. It's actually it's a pretty significant investment, and using Measure H this year, we've been able to essentially quadruple the amount of funding for that program. So we have some studies going on right now looking at the effectiveness of that approach and learning from what we've got. Obviously, one piece, though, at the very front end is in our shelter infrastructure and crisis housing. That's an area where we have not had enough beds. There are 3/4 of the youth experiencing homelessness in Los Angeles are are unsheltered, so they are on the streets, and they are often in places that are pretty hard to count, actually, which is, I wanted to get to that as one of the topics to talk about, is improving the quality of our count. But the rapid rehousing model that we've got here, this is the first time we've had a really large-scale infusion of resource for youth, and there are a lot of interesting innovations that our providers are putting together in terms of shared housing models for youth and other kinds of things. And I really, I think it offers a very significant promise for expansion. There's a lot of learning we have to do. It's the first time we've used this tool for that. Key to it is a really firm connection to employment services and to economic self-sufficiency for youth, and I think that's a piece that we still have to do. If I look at the youth coordinated entry system, you know, as a framework for pulling together all the resources that we have and having a systemic response so that there's, you know, solid coverage. Everybody in each region knows what resources are available, and they do case conferencing on individual cases. You know, we've already seen a pretty significant increase in the amount of housing placements. Last year, we put 1,209 youth into permanent housing in 2016, which was about a 25% increase over what we had the year before. And, you know, that's already an increase over what we had in 14. So it's, you know, it's just, we are learning and deploying these resources and getting better at it. Obviously, there is still a significant gap because at the same time that we increased the number of youth that we're placing into permanent housing by 24%, the actual number of youth homeless by our count went up 60%. So, you know, we're doing better, but not keeping pace with the number of youth who are falling into homelessness. I think that crisis housing being, you know, the opportunity to provide a 24-hour shelter for youth and bridge housing, which is what we use in you know, a shelter environment to help navigate youth from the streets into a permanent housing, are interventions that we're expanding really dramatically as well. So part of the Measure H funding is to expand those beds, and I won't rattle off a lot of numbers. I'll send you the numbers so you don't have to try to write them down as fast. But there's, you know, significant increase in the beds in those form factors, linked to the housing placements, because I think one of the things that's really key is to make sure that there's a trajectory through all of the resources that we have to placing youth, anyone experiencing homelessness, into permanent housing. One of the key things, obviously Measure H stepped up our resources for addressing youth homelessness really dramatically. So the year before Measure H, both the city and the county invested a significant increase in resources, $5 million through LASA. First year of Measure H, it's $20 million. So we had a, you know, quadrupling of the amount of funding for youth programming, and that includes street outreach. So that's not an activity that we were funding. We are funding it now. It includes housing navigation to help youth navigate through negotiating with landlords and finding units that they can afford. It includes crisis housing and rapid rehousing and all the other things, and also an infusion of resource for more regional coordination. Because I think that one of the things that's we've asked folks to work together, but we're not, you know, if we don't fund that activity, it's somebody's third job. So we're paying for them to actually do that. Rapid rehousing obviously provides case management services, and those are fairly rich for the youth set. And we actually, you know, we learned that we had to actually increase the amount of case management and service funding that we had, and increase the length of time in those services portfolios so that we could. So, you know, usually it's targeted to be about a 9-month intervention for single adults and families. We gave the providers for the youth up to 24 months to transition youth through those programs, because, you know, we don't want folks to essentially fail out of them. Mm-hmm. I think that, you know, Cynthia mentioned the importance of leveraging federal resources and also identifying with and working with federal policy. As the lead applicant for the continuum of care under the federal assistance grants, we've been working pretty aggressively to align the resources deployment that we have with federal policy. So we have reallocated from our transitional housing portfolio pretty aggressively over the last 3 years. But the last portion of it was our transition age youth portfolio, because there's a lot of you know, discussion in the provider community and out in the, you know, it's not clear from the literature that transitional housing, which has tended not to be factored as a best practice, tends to have worse outcomes and be more expensive than other housing interventions. But the idea that it's sort of developmentally appropriate for youth has kept it as a viable candidate, and HUD is still funding those programs. But this year, because we had an infusion of funding for Measure H, we could work with the provider community. Some of the challenges they face with the HUD-funded programs is that they have very tight mandates about who can enter, how long they can stay, program requirements. The admin funding for those programs is very, very parsimonious. It's not really, you're not actually able to administer the programs with the admin funding that's available. You have to go and leverage those. So working with the provider community, we just said, look, we could fund like and similar numbers of beds with more flexible program constraints using the local funding source and reallocate that money for permanent supportive housing for youth. And that's what we did. So we took the entire portfolio of rapid house of transition-age youth, federally funded programs. In this round, we reallocated them for permanent supportive housing because there's a serious need for long-term rental assistance and deep supportive services for a cadre of youth. We put 400 beds for permanent supportive housing for youth up, using the proceeds from the transition age youth transitional housing portfolio, and we will essentially swap out those funds with local dollars that have a lot more flexibility. I mean, including one key thing is we can pay a reasonable admin rate, which, you know, I think that's been a constraint for all the providers, is that those funds have just been too. On the youth count, I think that one of the things that's, you know, youth are very, very hard to count. I think there's a whole body of data that says that ordinary street PIT counts undercount youth because of the high degree of vulnerability that young people have on the street that don't want to sleep and be extremely vulnerable in an area that can be seen from the street. So the idea is that you can do a street count, but the kids who you're trying to capture in that, young people are not going to be visible. They burrow in, they sleep on commercial rooftops, they sleep in, dug in areas where they're just not visible. So the ordinary PIT count that has, very battle hardened for counting families, I mean, for single adults, it just won't work for youth. So we built using methodologies that have been, worked on and thought about from a variety of different perspectives. We put together a count that was survey-based during the day, with youth go out, survey their peers, and basically we did, a census over a sample of hotspots and, not expected hotspots and very rich survey data was captured through this. And our estimate, using the approach that we had this year, we've iterated it, year on year for several years now, but I think this one was the best count that we had. There's almost 6,000 youth homeless across the county of Los Angeles, which is a 60% increase over 2016's data. Statewide, there were about 11,000 homeless youth last year in California. We were about a third of that here, 3,700, something like that. But we don't have the full statewide results yet. But 6,000 is going to be a sizable part of California's overall youth thing. But I think it is really important to get better at counting youth and really get rich demographic data, because I think some of the data that emerge are really powerful. We ask our single adults, how many of you spend time in the foster system? 14% of the single adults who are experiencing homelessness right now went through the foster system, but for youth it was 25%. You ask, if you look at the ethnicity, African Americans are wildly, disproportionately overrepresented in our homelessness. Single adults is 40%, as opposed to a general population of 9%. So, but for homeless youth, it's also very disproportionate. 36% of homeless youth are African American, but we also see a very large proportion of Latino homeless youth, 41%, which is considerably closer to the sort of demographic share in the county. It's still less, but it's much more than it is for adults, which is around 27%. So, it's really important to have a good understanding of who it is that's experiencing homelessness and the demographics there, and get better at counting is key to understanding what we're doing. I just want to say, one of the last innovations that we have locally, and there's a lot of coordination going on through the Measure H funding. I think one of the key things for Measure H was the implementation of funding. Obviously, that was key, but it also spurred a tremendous amount of collaboration between agencies. There is a strategy focused on aligning the case management infrastructure of the mainstream services, which is an enormous infrastructure, and the kinds of work that Dr. Scoggins is talking about us working together and piloting warm handoffs between the foster system discharge and our system, so that kids never hit the streets and don't experience that, is really vitally important. And we have, but the last thing, the innovation, I think that's really very powerful, and this is something that we piloted in our single adults infrastructure under coordinated entry, is a funders collaborative. We have a table This was sponsored by our United Way Home for Good effort to end homelessness, which is a public-private alignment infrastructure. And they put together a table where public and private funders can align their funding decisions. And, we can make joint and collaborative decisions about the kinds of programs that we want to fund, and ensure that, where there is private money, which has a lot more flexibility than our money, they can target the aspects of the problem that we can't target, and they can fit into, they can do things that are experimental, they can do things that we don't otherwise have resource to do. So I think, there is a Youth Funders Collaborative. It has been meeting for several months and putting together its first request for proposal cycle. So that's the other thing. Obviously, it does fund, right? So the good news is it puts more money out, and we will align with that when we have new systems. Those are sort of, 4 different sort of emergent solution sets. One, obviously, is the Youth Coordinated Entry System. We can put together some literature on that. The second, obviously, is the tremendous coordination under Measure H. And, frankly, money talks, and there's nothing like, a huge resource infusion to help. Third being, really looking at innovations on counting youth and getting better data. And fourth being, put together the opportunity for public and private money to sit down around a collaborative, aligned framework of decision-making for funding. Thank you.
Thank you. That was great. I have a question I just want to ask for maybe just brief responses from each of the panelists. I think we saw in some of the previous panels the, emerging debate or discussion between housing first as opposed to service requirements or something in between. I'm just curious to know just your general
housing first
on that.
There's not. That's a discussion that has been solved. Like, the evidence is overwhelming. Even the gentleman, Walter, when Walter was talking about it, he talked about making the services right there and offering the services and keeping them right available to people. And that's what it is. So housing first is not the idea like whack them in there and like, let's see what happens. The idea behind housing is very simple. You can't really access services or be held accountable for them until you're housed. So the idea that you're going to get yourself sober, from a state of homelessness is just not fair. If you don't have a home, you don't have a door you can close and lock, it's just not that kind of environment. And as a guy who got himself sober, I will tell you it was the hardest thing I ever did, and it is unfathomable that we could expect people to get themselves sober from a position of homelessness. It's just not right. You wrap the services around the person once they're housed. That's it. It's not that like you're gonna pretend that, but the uptake on the services shouldn't throw someone out of a housing situation. Tenancy, if the fact that they're not taking services means that their behavior is such that they can't observe tenancy obligations, that's what will disrupt it. And they'll have maybe another iteration. But it's not based on, you don't lose your housing based on program violations. You lose your housing based on tenancy violations. All right, that's my opinion. Anyway, other people have other opinions. That's my opinion.
And it sounds like there are also probably, I hear like different almost definitions of housing first about what it means. There's a spectrum there too, so it's a little definitional, but either one of you.
Well, one of the things I neglected to say, I think it's important too that we find contract providers that can do a good job with our youth. Be dedicated, understanding, sensitive to our very, very diverse community in LA County. The LGBT community, the minority community, our tribal community, just everything across the map. We're finding that sometimes providers, housing contract providers, have a rough time with the youth, which is understandable because not all youth are cooperative. We understand that. We all were youth. But kind of out the gate, being prepared, holding them accountable to provide the services that we place our youth with in those programs, I think it's very important.
But if I may, and I talked a little bit about how overwhelmed I was as a teacher, I also know that social workers are overwhelmed with huge caseloads. And so them being, the counselors or the service providers being able to address some of these issues are also being impacted by the amount of caseloads that they're being given. So that's also a responsibility of the agencies to have a reasonable ratio so that they can provide those services to those youth. And I also see that as an issue in not, you know, going after you, but in my first year in human services, I found that that was a major issue. We kept saying, oh, there's this money available, but then that's not being distributed, if you will, to where the counselors and the social service providers have a manageable caseload. And in some cases, I forget what it was, but it was like 300 to 1. Not in this area, but there's some, you know, programs that the caseload is 300 per one. And when I asked the question about, is that manageable? They're like, well, we think so. You know, we think it is. And I'm like, seriously, I don't care who you are, a ratio of 300 to 1 is impossible. And so accountability also is towards the agencies, not just the service providers, because if the agencies are putting a burden on the social workers and the counselors, then how do you hold them accountable when they're overwhelmed? And so it's our job to hold the other layers accountable as well. I think that's also something that we're not discussing, because again, it sounds all great, and I don't want to be condescending in any way, but all of these issues we're discussing right now sound so great, it's not happening. And that's the reality. And so until we can be honest about why it's not happening, the accountability that you talk about, yes, we can hold counselors accountable, but what about accountability for the departments and for the management folks? Those folks are not being held accountable either. So how do we stop talking about these issues as if they're beautiful things, and they're really not? I mean, I grew up in downtown LA. I can tell you they're not. And so the honesty also has to come to us, because one of my frustrations in human services is when we had any reports, oh, everything's wonderful, everything's great, and I always stressed that I can't help you unless you're honest with me about what's not working. Because you can sit there and give me a beautiful presentation about what is working, but I can't help you if you don't tell me what's not. And I think there's a fear within those departments or agencies that if they are truthful, then somehow it's a bad thing. And my frustration is that it's clear the number of homeless youth or just issues that we have are huge. If we were doing such a great job, then it would be closer to 0. And it's not. So I appreciate you telling us all the great things that we're doing, but unless we address the issues, the things that we're not doing and where you need our help, I can't help you. And so, and again, I'm not directing it to you, but my experience, and I imagine that Senator Wiener has experienced some of the same frustrations that I have, where we get these beautiful presentations on how everything's great, but nobody's honest about what's not working. And how do we break through that curtain, I guess, if you want to call it that when the presentation's being made, it's to appease us as opposed to inform us, or as opposed to asking for some help from us. And you don't have to answer. I'm just, in general, have asked that question for the last 9 months from the Human Services Department, from all of the departments, because unless you tell me what I can help you with and stop telling me what great things we're doing and tell me what is not working, I can't help. We can't help if we don't know the truth about what's really happening and where the dysfunction is. It's human nature. I get it. It's human nature to try to protect yourself, and we want to pretend that the jobs that we're doing are great, but it's not reality. And so, again, not addressing it towards you, but the frustration in general for me has been is that we talk about everything that's going great. Well, then I can't help you with all the great things. Let me help you with the things that are not.
Yeah, thanks. I mean, and obviously just these systems need to be robustly funded. You know, speaking of the caseload issue, I know, McKinney-Vento liaison in the San Juan district who's got 1,800 homeless students on her caseload. So when you think about that ratio and just how you can meaningfully address, homelessness for that student, it's going to look like maybe bus passes, or maybe access to a backpack, but it's really difficult. In terms of housing first, that's essentially a harm reduction philosophy, which I would say youth providers across the state, by and large, deeply believe in harm reduction, low barrier, no barrier services. I think that the critique from youth providers tends to happen when they see housing divorced from supportive services that we know that youth in particular are going to need to be successful. So I think that's a lot of the challenge. That, of course, rapid rehousing, a young person might not be able to be successful, and if you get them, a housing voucher and they're able to find a landlord to rent to them, but they aren't able to have, a supportive provider or case manager to be successful, and they lose that housing. Now they've also got an eviction on their record, and there can be unintended consequences with something like that. I think it just means that the supportive services need to be designed, again, by young people, and they need to be relevant to meet their needs so that they are attractive to them. So I think that can be a more successful approach sometimes that can be in concert with housing first. I just think it's important for us to make sure that we're not just thinking about housing to the exclusion of the things that young folks need to be successful. Mm-hmm.
Okay, I want to just thank the panel, and I want to thank all three of our panels. We've now arrived at public comment. Could I just get a show of hands of everyone who's intending to make public comment? 1, 2, 3, 4, 5. Okay, great. If you would come forward, and we would just ask for public commenters, if you could try to keep your public comments within about 3 minutes, that would be really helpful to us. So if you're comfortable stating your name, and if you have an organizational affiliation, that's helpful to hear as well.
Thank you. Good afternoon, everyone. I want to thank you all for the opportunity to be here. Honestly, I did not plan on speaking today, but I felt called to, and like a true millennial, I'm going to use my smartphone that is in the palm of my hand, where it usually is. My name is Phoenix Lee. I am 20 years old, and I am a current client of the Youth Center on Highland here in Hollywood, and Safe Place for Youth located in Venice. This month marks the 10th month of my being homeless. But I have been very, very fortunate, and in the last 24 hours, actually, I'm again reminded of how lucky I am. I just acquired what finally feels more like stable housing, a very coveted spot at the LA Lgbt Center's transitional living program, and it's already making a huge difference. I can feel it right now. I don't have specific numbers or statistics, but I do want to echo the sentiments of my peers, Alexis, who spoke in the first panel, and Nova, who spoke in the second. And hopefully I'll be of help through sharing a piece of my story. The success and the current trajectory of my life right now, I greatly attribute that to those who were able to see me, see the whole human being, who recognize the importance of their role in working with youth, working through the lens of trauma-informed care. Which is what I hope to advocate for more by sharing the following. So based on who I am in statistics, you probably wouldn't expect this, but here's how by the time I was 19 in January 2017, I first found myself cutting up cardboard to sleep on 3rd Street behind Gold's Gym in Venice. Ever since I was young, I found myself perpetually in this state of simultaneous great success and near failure. So I'd get like a 32 on my ACT, woohoo, Ivy League stuff. I skipped 2nd grade, oh my gosh. Honestly, though, I really did have this reputation to live up to, but most people did not realize what was going on at home. And my life was such a mess that eventually I took initiative to live on my own by my senior year at 16. So I do not regret that decision, still do not, but of course, inevitably, the stress of perhaps adulting too soon, it led to me nearly failing my classes, and I almost didn't graduate high school. But at 17, I was a freshman in college, and
I had experienced various forms of trauma, even though in demographics, I grew up in an upper middle class, predominantly white suburban college town. Overall, I would perhaps be considered normal, your average college student. But not far into my first semester, I found myself lured and coerced, into a horrible situation that I only realized more recently was, by its very definition, sex trafficking. I remember in the beginning, I whispered to myself out loud, but quietly, of course, so that my owners wouldn't hear their slaves speak. I said to myself in near silence, "This is how I die." Thankfully, several months later, I managed to break away from this situation after I had my closest brush with death. And I realized that I couldn't wait any longer. I had to run for my life. After that, I continued my studies and my work, making $70 an hour. By the time I was 18, this phenomenon has been studied and recognized as a pattern with rape victims, this period of denial. But of course, I ran out of fuel eventually, took a medical leave from college, got fired from my job. My roommates grew tired of my PTSD and depression, and I found myself nearly overdosing on several occasions, once to the point that I was confined to a hospital bed for several days, as walking a few feet could work me into a heart attack and I could die. I tried to get help from mental health professionals, disabled student services, social workers at hospitals. I kept my faith in the system as it continually failed me. But eventually I found myself broke, ran out of money, and that's when, by January 2017, I was cutting up cardboard to sleep in the street. The next 6 months were spent mostly on the streets or in and out of mental hospitals. I started to notice a pattern that actually the nurses and social workers I connected with the most, they all told me the same thing. With love and my best interests in mind, they would honestly just tell me the truth, which is the truth of mental hospitals. And they said, "We can't help you. This environment is not healthy. Stay away before you find yourself spiraling down, stuck in this cycle." Eventually, I did wake up and I made a definitive decision in my head. From that day forward, I would never go to a psychiatric ward again. I also broke ties with the person who I called my street mom, who was back on crack and crystal. And in retaliation for my breaking my loyalty, she and her pimp nearly killed me in Bakersfield and attempted to sick all the Venice dealers on me. I'd had enough, and Safe Place for Youth, without a doubt, lives up to its name. I went to my case manager there at SPY, Janine Espejo, and she was able to connect me with the youth center on Highland, and I received shelter that very night. Again, this is someone getting very, very lucky. I don't think this is common at all. In all honesty, too, I think I was only supposed to stay for like 2 weeks, but people advocated for me and took a chance on me. And the result of that is that I recovered far more quickly, and my health became so much better than anyone had expected in just my first month. The key factors, I believe, were emotional and physical safety, being allowed to finally rest, being able to express my needs and being heard, and also, hey, being able to have fun. Like, I realized that I hadn't had fun in so long. I hate this word, and that probably means something, but I'll say it. Nurturing. I think I needed a nurturing environment, and, oh no. Okay, scrolling. I think I needed a nurturing environment, people who cared about me genuinely, and they believed in me. This had an enormous impact on how I functioned and was able to make positive change in my life. After this period of rehabilitation, I was then able to acquire an internship, get vocational training, and then focus on housing. So here lies my main point. We need to consider the whole human being. Trauma-informed care. It's a phrase that we've all probably used, especially considering this room, right? But it honestly isn't always enacted And it is so key to helping any homeless youth you encounter in order for them to succeed. Again, I'm incredibly lucky. Unfortunately, not all of my peers have had the same experience, and for many of them, I believe they have not received the kind of support that they truly need.
Right.
Yeah, so I'm sorry that I'm going on so long, but yeah, I think we focus on education, employment, housing, right? But so much comes before that. How do we enact this on the level of legislation? I think that's up to you guys. So yeah, those are just my 2 cents.
I appreciate
Thank
it.
you.
Thank
Thank you for your
for
time.
sharing.
Thank you.
I'm glad things are working out better for you.
Good
Next speaker.
afternoon. My name is Melissa Schoonmaker. I am from the Los Angeles County Office of Education. I'm the homeless liaison for the county. So I'm very happy to be here, and I listening to today, and I thank you, Senator Wiener, Assembly Member Rubio, for pulling this together. I was very happy, Assembly Member Rubio, to hear you speak about education. It is something I am extremely passionate about. And the fact that LA County has 63,000 homeless children in schools and they're in 80 school districts and 270 plus charter schools, and they are everywhere in this county. And that's not even counting we don't do a great job of looking at our transitional age youth and doing a count. It's like you've heard all day, they hide. They have a very hard time coming forward. As one of the last speakers, the youth had shared, coming forward and sharing that information she wasn't feeling it with the staff. We do a lot of time spending our job training, et cetera. But what I really want to share with you is that looking at, when they look at the housing and urban development, those outcomes are based on employment and housing usually, and education is not always a piece of that. And so I implore you, as you look at strategizing ways to look at this, we want to make sure that our youth, as they're in school, they stay in school, they finish, they graduate, and they're able to pursue whatever their next step is. So if it's a trade school, if it's college, whatever that means for them, we want to get them, whether they're transition age youth, and getting them reconnected back into school or to trade or like a community college, so they can pursue what their next step is. But I implore you to continue to talk about education as a part of that pathway, because I think sometimes it gets lost in outcomes looking at employment and housing. And you can't have in LA affordable housing. If you're earning minimum wage, you would have to have 3 full-time jobs to afford that. And so education is a pathway for our youth to not become homeless adults. So I want to thank you for convening today and for allowing my 2 cents as well.
Thank you very much.
Hi, my name is Rusty Rothstein. I am a former special ed teacher and disability rehab specialist. And I guess at this point I'm an independent consultant and advocate for both people with disabilities and for the LGBTQ community. And I guess I was curious, and I'm not looking for an answer right now, but why people with disabilities didn't show up on our list of things to look at, because I am fairly sure that somewhere along the line, people with especially mild disabilities are a good part of that population that's going to end up being homeless. And secondly, I'm concerned about what's going on at the federal level with that person that's sitting in the White House and the way he has tended to deprioritize and defund programs that deal with people of color, with the LGBT community, for immigrants, and so many others. And I don't know how that's going to affect the programs, but somewhere along the line we're going to be getting less money from the federal level, and that means less money at the state level to share for these programs. And we need to find a way to make that up.
Thank you.
Good afternoon. I'm Kim Lewis with the California Coalition for Youth, and I wanted to thank Senator Wiener and Assemblymember Rubio for putting together today's hearing, and for Assemblymember Reyes and Senator Leva's engagement and interest in this topic, and for your staff for the amount of work that went into putting together this hearing. CCY has been working on these issues for a while, and you have in front of you, we provided you a copy with what we think is a plan to address this issue in California and a unique opportunity that we have with the passage of Prop 64, the Adult Use of Marijuana Act, and in the Prevention, Early Intervention, and Treatment account, where there is calls out for supports and programs to support homeless youth, especially. And so we really look forward to working with you in the upcoming year, and please let us know how we can help to tackle this issue so it is one time for our youth. Thank you.
Thank you very much. Any additional public comments?
Slightly vertically challenged I am. My name's Tamsin Sterling. I'm a visitor from Wales. I've been visiting the Lgbt Centre, Youth Centre, and Covenant House, and LASA and other services. I'm on a travel fellowship looking at youth homelessness, both in California and Canada. So today's been really interesting. I'm travelling to Sacramento tomorrow, so it's been a really good way to finish off my few days in Los Angeles. Just three things as an observer looking in on things, on youth homelessness, what are the bits that I've learned in the last few days. First thing is just fearsomely complicated. And I've got 25 years research experience, so if it's fearsomely complicated for me, I can totally understand why it's ridiculously complicated for a young person trying to get the right service at the right time to meet their needs. The second point is on the education side of things. There's a project in Wales which is called Encompasses, which is a assertive outreach project that works in schools around linking with teachers and providing some support and services to kids who are at risk of homelessness from the age of 14 up, and I'd be delighted to send some information to you if that would be useful. And the third thing is I'm a researcher, so I love accurate data and information, but it would be an observation. You'll never get the perfect information about the number of homeless young people across the county, and it's always good to be improving the information and improving the way in which it's collected, particularly involving young people in that. But for heaven's sake, don't wait for perfect information before you crack on and do stuff, because I think there seem to be some real opportunities in terms of resources, in terms of commitment, in terms of energy, certainly the energy I've experienced from the organisations I've visited to really tackle this issue, which, as several people have said this afternoon, should not be a feature of a civilised 21st century society. So thank you for letting me have some words.
Thank you very much. Is there any additional public comment? Okay, seeing none, we'll close public comment. So that concludes our hearing today. I think this was incredibly helpful with a lot of really tangible ideas, a lot of great data, and just a diversity of perspectives. I know I am absolutely committed to working on this issue, trying to, as I mentioned at the beginning, elevating the issue in Sacramento, trying to really address the significant funding gaps. And I know Assemblymember Rubio and I were actually chatting, and I think we're going to try to work on something for next year and when the legislature reconvenes. And so we look forward to working with the advocacy community and the provider community and local governments to try to come up with a nice framework. And I know there's been a lot of thinking that's already gone into this, and I look forward to reading what you provided. So thank you to everyone who participated, and I look forward to a nice group effort to tackle an issue which, and I think Cherilyn Adams was absolutely right. This is a population like veterans, like homeless families, that if you really do focused, smart work, you can end it. And we have an obligation to do that.
Thank you, and I thank you as well. I think the information that we shared today was great, and I think for me, I feel like we have the solutions at our fingertips. I heard from so many different panelists that I think if we combine those efforts and take a little bit of the things that are working from everybody, I think we have the solutions in front of us. But it's going to take some work, some collaboration between the community, the advocates, the agencies, and to help us come up with some tangible solutions to this, and I think we have them. I don't know if you heard what I heard, but I think I heard that there's a solution. It's just all in pieces right now, and if we can figure out how to put it together, I think we can move in the right direction. And I, too, am committed with Senator Wiener on working on some, powerful solutions. And I know that I think Senator Leyva and Assemblymember Reyes, I know their being here shows their commitment as well, and we'll be hopefully collaborating and trying to figure out how we can move forward with this. I really thank you for the opportunity to speak to you, and I thank the LGBT Center for hosting us today, because it takes, somebody said it earlier, it takes a village, and it really does, and I think if we work together, we can come to some solutions. So thank you again for participating and being here. I know we're all fighting traffic in a little bit, so good luck. I'm from LA, so.
Counting our homeless youth. If we build it, they will come.
Yep.
My final comment, with my DACA students, when we were working with our DACA students, the one thing they told me is, if you want to help us, ask us what we need. Don't just assume you know what we need. And that's why I'm so grateful to the youth who have shared their stories, and I hope that you will work with us in finding those solutions. Thank you.
Okay, so with that, we are adjourned.